like to call to order the Board of Supervisors meeting for Tuesday, October 23rd. Supervisor Valle?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Approval of minutes, Tuesday, October 2nd, regular. All in favor, 3 ayes, 2 excused. We'll go to closed session. Supervisors meeting for today. Hold on a second. Consent calendar, item 54 to 73.1.
Second.
Any discussion? All in favor? 4 ayes, 1 excused. Do we have a mass? Do we have the mass motion?
We do.
Okay. Could we take that, please?
Madam Chair, I'd like to move the following items in one motion, beginning with item 2, 3, 4, 5, 5.1, 6,
Not
7.
5.1.
Your question on 5.1?
Not 5.1, we have speakers.
Okay. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 25, 26, 27, 28, 29, 30, 30.1, 31, 32, 33. I have a question on 34. Yes, ma'am. I also have a question on 35. Pull that in. 36, 37, 38, 39, 40, 41, 44, 45, 46, 47, and 48 and 49.
We have a second on those? Any questions on those?
Second? Is there a second?
Second? Okay. Questions? All in favor, 4 ayes, 1 excused. We're going to go to item 5.1.
Good morning, members of the board. My name is Colleen Chavla. I'm the Healthcare Services Agency Director, and I'm here to present to you item 5.1, which is a request for your approval for ambulance service, 911 ambulance transport service. I'm here today to recommend that your board approve a contract with Falk Northern California Corporation to provide 911 emergency ambulance transport services for Alameda County's exclusive operating area, which comprises all of Alameda County with the exception of the cities of Albany, Alameda, Berkeley, and Piedmont, and Lawrence Livermore National Labs. The contract before you today is based on a request for proposals that includes clinical design improvements that will enhance, provides for improved treatment of emergency response systems, it's a system to efficiently manage differences in volume and geography across the county. Presentation, I will review the request for proposals process, discuss the evaluation of bids and the selection process, and provide an overview of Falk, the bidder that received the highest score, and then provide an overview of their proposal and the proposed contract. As background to the RFP process, it's important to know the roles and responsibilities of the state and local EMS agencies. We are currently under a deadline imposed by the state EMS agency to enter into a new 911 ambulance contract to be effective July 1, 2019, or risk losing our exclusive operating area. The exclusive operating area, or EOA, is a monopoly granted by the California EMS Authority in order to provide stability to an EMS system. EOAs are allowable monopolies because of the overriding public interest in ensuring the availability of emergency response services to all residents. EOAs allow for systems planning to ensure an equitable amount and distribution of 911 ambulance services countywide, a uniform standard of quality clinical care, and extensive contract compliance mechanisms. The state EMS agency authorizes the local EOA and must approve all procurements for ambulance services for that EOA. The local EMS agency is responsible for carrying out a fair and competitive RFP process to identify an EOA provider. The July 1, 2019 deadline was imposed by the state EMS agency in 2017 as a result of material changes made to the county's current agreement with Paramedics Plus that diverged from both the prior EMSA approved RFP and the initial award to Paramedics Plus in 2010. Failure to have a contracted provider operating consistent with the current RFP in place by next July 1st would result in the loss of our exclusive operating area. Without the contract-based monopoly an EOA allows, there would be an open, fee-based model of service, an open operating area. An open operating area would put lives at risk in our county. It would result in variations in care by location across socioeconomic and geographic lines. It would create a deterioration of service to our community below the current standard. And the loss of our EOA, as I said, would put our residents' lives at risk. Understanding the critical nature of this RFP, it was designed with these goals in mind. First and foremost, we wanted to ensure that the highest clinical and operational quality was provided for Alameda County residents. Support of the workforce was important to reduce risks associated with provider fatigue. This was done by limiting consecutive hours worked.
Excuse me, there's a question.
Yes.
So we may interrupt you.
Yeah, if you don't mind, it's just for the sake of the audience. The presentation is 25 pages, and Colleen's on page 4. And I don't want you to lose momentum, but at the same time, I don't want to lose momentum either. So one of the statements that you made was that we have an obligation to our constituents to make this award, and there's time is of the essence. I understand that. Can we request an extension of the time period from the state EMSA?
We could request it. It's not clear whether it would be granted, and it would also require the extension of the current contract with Paramedics Plus.
I understand. So we can request an extension if necessary.
We could request it. I'm not certain that it would be granted, given that we were given 2 years.
That's understood. I understand. Okay. Thank you.
Okay. I will try to be speedy.
What page are you on? 5?
I am on slide 5.
Okay.
So we support the RFP goals were to support the workforce and was important to reduce risks associated with provider fatigue. We understood the critical importance of financial stability for the next ambulance contract provider, and we wanted a system that gets the right care to the right patient within the right time at a responsible rate. 911 ambulance services for the EOA are not paid for by the county. Instead, these ambulance services are funded entirely by fee-for-service revenue from third-party payers or patients. The Affordable Care Act, which was passed in 2010 and implemented in 2014, has resulted in shifts in the payer mix that impact the entire health sector, including 911 ambulance transport services. In 2008, you can see that the largest proportions of ambulance transports in Alameda County were either those covered by commercial insurance, represented in blue, or those that were self-pay, represented in yellow. In 2016, the proportion of commercial and self-pay patients were half of what they were in 2008. Instead, the proportion of government payers, Medi-Cal and Medicare, grew significantly. This RFP was designed with these shifts in mind. EMS contracted with Citygate as a consultant for a complete review of the EMS system, development of the EMS system and development of the system moving forward. The approach was to make responsible and effective evidence-based changes to the system that addressed system need while considering the shifting financial considerations for EMS. Several system improvements were made. Our agency's robust clinical data system enabled a rapid response reprioritization, integration of historical clinical data into the medical priority dispatch system to better prioritize calls and determine the appropriate level of response. The zone structure was changed. The system is going from 4 zones to 3 zones, reducing complexity for the provider. And the zones, which are better defined based on call volume, geographic location, and infrastructure. The deployment model was improved so that each zone would be served based on their individual demand and geography, with minimal movements of ambulances across zones. In simple terms, this means improved regional deployment, more resources on the road, and reduced wait time for ambulances. The system changes also include increased system supervision. Because more than 50% of EMS call volume originates in Oakland, the new model requires a second clinical field supervisor in the north zone that includes Oakland. To mitigate provider fatigue, the new model implements shift length limitations and monthly monitoring of unit holdover. As previously approved by your board, the EMS agency is seeking to implement a program that provides for alternative transport for behavioral health needs. This would utilize resources other than 911 ambulances to assess and transport individuals with behavioral health needs who have no medical concerns. The new system changes also include improved compliance monitoring, reducing from the overly complex 61 compliance categories to a streamlined 18 compliance categories.
A question.
Yes.
So going back to that slide, please.
Going back to the which one?
The previous slide. 7. Alternative transport plan for behavioral health needs. I personally have 5150 two people, and each time that I did it, the fire department showed up. The police department showed up first, then the fire department, and then I believe the ambulance service was on standby. When you say alternative transport plan for behavioral health needs, what does that mean?
By the Mental Health Services Act that would pair a paramedic and an ambulance with a behavioral health clinician to respond to 5150 calls. In that way, they can do medical triage in the field and not have to go to the hospital to get them medically cleared before continuing on for their 5150 designation. So it allows for treatment in the field and assessment in the field, as well as a clinician who can interact with the patient to determine whether they can go to an alternate destination rather than to psychiatric emergency services.
Where the police officers showed up, this is San Leandro, by the way, and they asked me to leave the premises while they interviewed the person in question. Explain to me that scenario, how it would run under this model.
Sometimes law enforcement is required in order to secure a situation, and that would still be the case if it's a dangerous situation. But in instances where that is not the case, and when an individual would willingly go in an through alternate transport, that's when this program would come into play. And in those instances, it would free up 911 ambulances to participate in the rest of the system.
Transport. What's the vehicle that's going to transport?
Ambulance, but it's not part of the 911 system. That's why it's the partnership with the ambulance provider.
Okay. And that was part of the RFP?
That's correct.
Okay. Thank you.
So just a brief overview of the RFP process and timeline. Following notification of the state EMS agency's rescission of Alameda County's EOA effective June 30, 2019, the local EMS agency issued a new RFP in October 2017. Completion of a new competitive RFP process resulting in the implementation of a provider prior to June 30, 2019 was identified by the state EMS agency as the only path to retain Alameda County's EOA. The original deadline for bids was May 2018. A legal challenge by the California Fire Chiefs Association resulted in a modification to the RFP and an extension of the bid response timeline by 2 months from May to July 2018. Evaluation of the proposals occurred in July and August. The RFP prescribed protest and appeals processes ran from August to October. Already under a tight time frame under which to implement the transition of countywide 911 ambulance services, we brought this contract to you for your board's consideration today at the earliest possible opportunity. The County Selection Committee comprised 4 people with extensive experience in 911 advanced life support ambulance services. One was a current EMS medical director, another was a current EMS director, the third was a current contract compliance specialist, and the fourth was a former EMS director for Alameda County. The County Selection Committee reviewed proposals and conducted an in-person evaluation. As part of their proposal review, the intent, rationale, and relevance of each element of the RFP was reviewed with the members to ensure that they were aware of the EMS system's minimum performance requirements and expectations as defined. In addition to a review of their written proposals, bidders made in-person individual presentations to the CSC, at which time CSC members could ask focused or clarifying questions. After in-person interviews, the CSC was given an opportunity to review their preliminary scores and make any changes necessary before arriving at a final score. The CSC's process resulted in a recommendation of the top scoring bidder in accordance with the evaluation criteria set forth in the RFP. To ensure that a candid and objective discussion amongst CSC members was allowed, there were no representatives from the EMS agency or other county departments present during these discussions. The RFP included 16 evaluation criteria, 8 minimum qualifications criteria that were scored on a pass-fail basis, and 8 capability and commitment criteria that were scored in a point system. Only bidders meeting the minimum qualification criteria would move on to be scored on the point-based system for capability and commitment. I want to highlight 3 key elements of the minimum qualification criteria here that I will get to later when we talk specifically about Falk's proposal. The first is financial condition, which requires that the bidder provide evidence that clearly documents the financial history of the organization and demonstrates that it has the financial capability to handle the expansion necessitated by the award of the contract. The second is experience of bidders' key personnel. Key personnel must have had, for 2 of the last 5 calendar years, been providing 911 advanced life support ambulance services for an operating area of greater than 800,000 persons with size, geographical spread, population density, and call volume proportionately similar to those of Alameda County's EOA. The third criteria was experience of the bidder itself providing ALS services, which requires that the bidder must have existed and continuously provided pre-hospital, advanced life support, emergency medical services for a minimum of 5 years in the United States. This combination of experience of the bidder and the bidder's key personnel was specifically designed to ensure that the greatest number of qualified bidders and to provide the highest quality of care for Alameda County.
Question, Colleen.
Yes.
You just said a minimum of 5 years. There's an addendum number 2 that was released, and that says a minimum of 2 of the most recent calendar years.
Is that for them? My apologies, 2 is correct.
So we changed the criteria?
We changed the
RFP?
criteria. In any event, the bidder met qualifications, but we changed the criteria.
Okay.
My apologies. The 8 commitment and capability criteria were assigned points and with clinical quality, deployment plan, operations management, and administration, and cost, all weighted equally and highest. Two independent consultants were engaged as part of this RFP process. I mentioned earlier that Citygate served as a consultant to review the existing system and aid in the development of the system redesign within the RFP. Upon receipt of the bidder proposals, Citygate also reviewed and provided analysis of the financials for both the parent company and bidding company for each proposal, and also reviewed and provided analysis of the proposed operational deployment of each proposal against system design and community need. A secondary financial review was included due to the financial concerns that arose during the current agreement. Kevin Harper reviewed and provided separate analysis of the financials for both the parent company and bidding company for each proposal and provided financial analysis support to the CSC. Staff from the Healthcare Services Agency entered all CSC member scores into a master spreadsheet for final score calculations after completion of the review process. The weighted scores assigned by each individual committee member were then averaged, and the results were tallied to determine a final score for each bidder's proposal. Falk was the top scorer at 355 points. American Medical Response West was in second place at 331, and Paramedics Plus was in third at 295. So now I'll transition to talk a little bit about Falk. Falk is the largest emergency medical services provider in the world. In operation for more than 100 years, Falk operates in 22 countries with more than 2,500 ambulances, responding to 4 million calls each year. The contractor I'm recommending to you today, Falk Northern California, is a subsidiary of the Falk Group based out of Denmark. Falk has an institutional commitment to service, which is evidenced by their 2 largest shareholders. 85% of the Falk Group is held by 2 organizations. The largest and controlling share is the Lundbeck Foundation at 57%, a Danish-based commercial foundation devoted to improving health and well-being through supporting research at the highest level, primarily within biomedicine and natural sciences. The Lundbeck Foundation supports research worldwide with the largest recent grant of over $18 million to fund pioneering research into mechanisms behind some major psychiatric diseases. The Kirkby Group is a holding and investment company owned by the family that created the Lego brand. Through the Lego Foundation, Kirkby supports a number of nonprofit causes helping to inspire and educate children. Partnered with the Tinkering Studio, part of the San Francisco Exploratorium, to integrate technologies into tinkering activities and to support innovative tools through learning and play.
Colleen, and you don't need to go back to the slide. So, wait, not that one, the next one. Not that
One more?
either. Forget it. Let me just ask my question. There we go. What I'm interested in seeing is the actual bidding sheets with the redacted names of the scores. Would that be possible to get?
We provided summary sheets for all of the scoring. I can give you the summary of the score. I think it's by, I have it here. It's by evaluator for the summary.
I'm sorry, are you going to this binder?
Sorry?
In this binder?
It's not in there.
Okay.
I have a copy of it that I can provide to you. Do you want me to put it on the overhead?
I'd like to see it.
I can put it on the overhead.
So it'll be the individual areas in which you did the scoring?
I'm sorry.
The individual categories?
It has the total scores for each evaluator for each bidder.
That's not what I'm looking for. What I wanted to see was the actual sheets that, and the criteria where you can put that up, but the criteria for each category, because I'd like to see where Falk performs so well and say paramedics perform so poorly.
Are those releasable?
Can I see that?
No, he
Because
wants it
it might not be worth putting up.
Okay, can you get that and then you can continue? Or is that not allowed to be shown?
That's what I'm asking.
He's just asking for the scoring in individual categories of criteria, not by name or anything. I mean, not by person.
So I don't understand though. Because if I look at this, percent of points, oh, I see. Okay, I do understand now. Yeah, I wanted to see the individual categories of each score. I mean, I'm not sure that somebody just walked up and said, okay, I'm going to give AMR 355. There must have been some data to get there. You can have this back. It's up to the public if they want it up or not.
So can that be made available or not, County Council?
I think as long as the names are redacted of the actual score, it could be. Sorry.
That information can be provided.
Can be provided. Okay, continue while somebody gets that. Colleen, continue while somebody
Yeah, I'm
goes
trying
to
make
get
sure
that.
somebody's got it. Okay. So across the United States, Falk provides 911 operations in 8 jurisdictions. This means they're contracted or authorized to provide 911 emergency ground ambulance transport. They provide backup 911 operations in 2 jurisdictions, which means they're contracted or authorized to provide assistance to the primary provider in the provision of 911 emergency ground ambulance transport. They provide interfacility operations transport in jurisdictions in 9 states, meaning they provide basic life support, advanced life support, or critical care transport transfers between facilities outside of the 911 system. You're probably already aware of these distinctions, but in ascending order of clinical complexity, BLS means, or or basic life support means emergency medical technician level of care. Advanced life support, or ALS, means paramedic level care and allows the transport of critical patients in a mobile hospital setting. And critical care transport is a nursing level or advanced level or scope of paramedic care, and like ALS, also allows for the transport of critical patients in a mobile hospital setting. Falk's in-house billing operation is also based in the United States. In California, Falk operates as Falk Northern California and Vera Health in Northern California, and Care Ambulance in Southern California. Accredited throughout California by the Commission on the Accreditation of Ambulance Services, they are the 911 EMS provider in Mendocino, Los Angeles, and Orange County, as well as the city of Occidental. They respond to more than 411,000 calls every year, more than 75% of which are 911 calls. They have had 100% response time compliance rate since their entry into California in 1998. And in addition to ALS intra-facility transport experience in jurisdictions in several other states, they also provide ALS-level inter-facility transport service in Santa Clara and Sacramento counties. You'll recall that I referenced earlier 2 minimum experience qualifications under the RFP, experience of key personnel and experience of bidder. This ALS experience exceeds the minimum qualifications required of the bidder to have continuously provided pre-hospital ALS emergency medical services for a minimum of 2 years in the United States. Falk has been in the U.S. for decades, first in Georgia in 1994 and in Northern California since 2006. The second element of the minimum experience requirements under the RFP relate to the experience of key personnel. A bidder's key personnel must have experience providing 911 advanced life support ambulance services for an operating area of greater than 800,000 persons with a size, geographical spread, population density, and call volume similar to Alameda County's EOA. This slide lists the key personnel that will be employed to work on this contract if approved by your board. These leadership staff, some of whom are here today, exceed the minimum experience requirements laid out in this RFP. The minimum experience requirements that I just described demonstrate Falk's experience from a clinical perspective. Falk has experience providing ALS level care, and their key staff have experience providing ALS level care in a 911 system. Additionally, Falk has 911 emergency response experience at the BLS level in an area larger than Alameda County's EOA. As the 911 provider in portions of Los Angeles and Orange counties, they cover a population of more than 5.5 million and more than 1,100 square miles. Last week, I was at an annual meeting of the County Health Executives Association, a CSAC affiliate. I had the opportunity to talk to the EMS directors in Los Angeles and Orange counties about their experience with Falk in their jurisdictions. Both directors reported a positive experience and stated that Falk provides them with good service and that they're easy to work with and they're happy with their service. The third important minimum qualification for the RFP that I highlighted earlier was financial condition. You'll recall that the requirement was that the bidder provide evidence that clearly documents the financial history of the organization and demonstrates that it has the financial capability to handle the expansion necessitated by the award of the contract. As reviewed by our independent consultants, Falk provided deep and transparent financial information. They are privately owned with more than $3 billion in total assets. Falk Group has allocated $39 million for contract assets and working capital to support this project. Upon execution of the contract, they will issue a $15 million letter of assurity. Falk is in good standing with existing contracts confirmed through an interview process with contract holders, and Falk has never lost a contract for 911 services once it has been awarded. Falk will also be actively pursuing a contract with ACREC for emergency medical dispatch services. If approved, Falk will be purchasing 77 new ambulances for this contract. They will be soliciting the feedback of the workforce, fire agencies, and county EMS as it selects equipment. For data management, Falk will transition to the electronic patient care record from ESO Solutions. ESO's electronic patient care record was identified as the preferred patient care record software by the Alameda County Fire Chief's EMS section. Falk will be a key partner in some of the innovative programs that Alameda County is launching, including the Community Assessment and Treatment Team that I just explained to Supervisor Valle earlier, and will also support the Social Health Information Exchange that is being launched as part of Alameda County Care Connect to integrate EMS data into other systems to improve care and social services within Alameda County. As I mentioned previously, 911 ambulance services for the EOA are not paid for by the county. Instead, these ambulance services are funded entirely by fee-for-service revenue from third-party payers or patients. This slide lists the rate proposed by Falk, other proposers, and compared to current rates. When it comes to billing, Falk has a history of working with patients on payment options. They routinely offer monthly payments over a 12-month payment plan. They offer a prompt pay discount for accounts that are not a copay or deductible. They offer a 25% discount for the uninsured and can make arrangements to make those payments over a 12-month period. And they can also offer the uninsured both the prompt pay and uninsured discount for people who pay at the time of the call. In instances of hardship or charity care, Falk also has an application process that reviews an individual's financial information and it may offer a reduction based on their income and assets, and in some cases it may be a full write-off of charges. I mentioned a moment ago that I'd recently had the occasion to talk with the EMS directors in Los Angeles and Orange County about their experience with Falk, and the Los Angeles County EMS director in particular indicated that she receives very few complaints about billing from Falk patients and constituents. Falk's current workforce consists of EMTs, paramedics, and ancillary staff such as vehicle service technicians and scheduling represented by NAGE, the National Association of Government Employees. Mechanics are represented by International Machinists Union. Falk has agreed to hire all members of the existing Paramedics Plus workforce that are interested in transitioning and pass their background checks. They've been in discussions with the unions representing that workforce and have agreed to honor their existing contracts, including seniority, wages, and benefits.
Question.
Falk has proposed, yes.
On that point, was the issue of hiring existing staff, et cetera, and honoring the labor agreement, was that one of the criteria in the evaluation and scoring?
It was not.
Was not.
Not the labor portion.
Okay, thank you.
Falk proposes to locate 13 relief stations across the county to provide staff the ability to get out of the ambulance while awaiting a call and have access to private location, to utilize a restroom, heat up food, complete paperwork, and rest. Without these private stations, workforce would post in public locations, often within the confines of their ambulance, relying on public facilities or businesses to provide for their basic human needs. The proposal also includes a powered system that raises and lowers and loads and unloads a gurney with the touch of a button to help prevent workplace injuries. Recognizing that fire departments are a critical first response partner, there are several elements of the proposed contract that would also be beneficial to fire personnel. As I mentioned earlier, the electronic patient care record, the ESO platform, is preferred as determined by the Alameda County Fire Chiefs EMS Section Committee. Priority in hiring for fire personnel for part-time positions. Paramedics, as part of their training, are required to successfully complete a classroom component and then both a clinical rotation in an ER and an internship on an ambulance. Falk will provide priority placement for Alameda County fire agencies that will allow their personnel upgrading from EMT to paramedic to do so in a more expeditious manner. Once in a while, fire paramedics are asked to ride along when a BLS ambulance responds and ALS care is required. Historically, this is between 2 and 4% of BLS transports and less than 1% of all transports. But in these instances, Falk's proposal proposes to provide a pass-through of funding to compensate fire agencies for this time, which could be a difference between the ALS and BLS rates or a negotiated rate. Alameda County takes pride in its partnerships with community, and our RFP reflected that, and Falk responded to that call. Falk will have a dedicated full-time community education specialist to oversee community programs and education, as well as apply for grant funding to expand community outreach opportunities. It also proposed an allocated budget of $100,000 annually. Among the programs they will be participating in are EMS Corps, the PSAs for ambulances for putting a custom design shrink wrap around their ambulances to promote health and wellness initiatives in the community during routine operations. The Every 15-Minute program, that's a 2-day program focusing on high school juniors and seniors, which challenges them to think about drinking, driving, and personal safety. The Community Emergency Response Team, which educates volunteers about disaster preparedness for hazards that may impact their area and trains them in basic disaster response. Safe Kids program, which provides infant and child safety seat instruction and installation, bicycle safety, and safe routes to schools. The Senior Injury Prevention program, which provides programs such as senior welfare checks and senior risk assessments and fall prevention. And the Stop the Bleed campaign, which is a national awareness campaign and call to action intended to cultivate grassroots efforts that encourage bystanders to be trained until professional help arrives. So in summary, this agreement term would be from October 2018 to June 2024. This time encompasses ramp-up time for activities to ensure readiness to take over service on July 1, 2019. It's important to note that the manufacture and certification of new ambulances alone can take up to 6 months' time. There's no impact on county budget. Contractor services in the agreement are funded through revenue generated via billing for ambulance services. And the patient cost is noted here as proposed by Falk in its proposal.
Something just hit me that I needed to clarify. I've looked at that last slide several times in the bids, but I never really digested the mileage. Is that $51.78 per mile?
Yes.
Too bad the IRS doesn't reimburse at that rate.
And it is consistent with the mileage proposed by all bidders.
That's some expensive stuff.
I'm sorry?
That's pretty expensive. If my math is correct, 10 miles is $510, $517.
So, in summary, the contract that we're recommending to you today will provide an increased level of service, more ambulance deployed on the street than proposed by other providers, and commitment to provider training and education. It will promote retention of the workforce, as Falk has agreed to hire existing workforce and honor their current union agreements to include seniority, wages, and benefits. It is a financially stable organization with a set aside of the largest startup for working capital of the 3 bidders without a high additional cost of repayment with interest to their parent company, and has committed support of the Falk Group for the term of the agreement. We have an experienced provider. They're the largest provider of EMS services in the world, with a proven track record both domestically and internationally in providing ALS, BLS, and 911 services, and with reasonable charges, the lowest cost that was aligned with a very credible, as determined by Citygate, deployment plan and the financial commitment of the Falk Group behind it. Charges are a modest increase from the current rates with a greater level of service. And finally, this contract will provide enhanced collaboration, engaging with partners regarding the provision of service in the county, priority part-time hiring, priority EMT to paramedic internship placement, and reimbursement when required ALS when a BLS transport responds.
Okay, thank you. When are we going to get the documents?
So we've sent someone, and just to clarify, we don't have the actual, I don't believe anyone has present here today, the actual score sheets redacted, but we do have a chart that shows the scores by category input into like an Excel spreadsheet. So we are having that copied now to be available for you.
Okay. I'm sure there are a lot of questions. I'm going to start with Supervisor Miley.
I've got a few questions, but I also want to hear the speakers too. So the open operating area, are there other counties that have open operating areas?
There are. So the most often cited open operating area is the San Francisco EOA, which is a longstanding AOA with three ambulance providers providing care in a smaller proportion of the county, when the fire providing response in the larger proportion of the county. And in that county, it has been noted that response times were lower than in other places. Our response times are consistently at 90%, and in San Francisco, they have been lower in the past.
And that's the only county in the state that has an open operating area?
There are others as well. I don't have as much data on the others.
Yeah, because it was stated that open operating area, the service would be diminished, and I just want to verify that.
So in a complete open operating area, the ambulance response would be motivated by the ability to get reimbursed for the cost of their response. And so that would mean that areas that have less density and might take longer to respond because ambulances would not have incentive to be stationed in those areas, and areas that have a poor or payer mix where there are higher numbers of uninsured or Medi-Cal patients, which is a low reimburser for ambulance services, might also suffer.
And that's not based on opinion, that's factual.
That's based on research.
Pardon me?
Based on research.
Okay.
Okay.
Then with the local EMS agency, is there any other county department that could take on that responsibility?
Is there any other department that I think could take on the responsibility of the local EMS agency?
Yeah.
I don't think so. It had previously been in the public health department, but always within the EMS and the healthcare services agency.
And so fire wouldn't qualify?
I do not believe fire would qualify, but that might be a legal question.
Would you like me to respond?
Of course. Somebody's going to respond, please.
Based on our review of the Fire District Protection Act, operating as an EMS agency is not one of the duties that they are authorized to perform. They are authorized to provide ambulance services, and they could enter into a contract to provide ambulance services. But operating as the local emergency medical services agency is not specified within the authority granted to a fire district established under the under the Fire Protection District law.
Okay. So as I understand it, California EMS Authority gives responsibility to a local EMS agency, and in Alameda County, that local EMS agency is healthcare, right? Is that kind of how that works?
In Alameda County, the local EMS agency is the EMS agency.
Yeah.
And it's housed within the county, it's housed within healthcare.
And what you're saying is that authority couldn't be transferred to the fire department, right? That's what you're saying.
That's what I'm saying.
And that's based on legal research.
Yes.
Okay. And then if we're not part of the California authority, then we wouldn't have this exclusive operating area. We'd have an open operating area. And if we have an open operating area, you're saying that that would diminish the quality of service, right?
So I need to correct one thing that you said. We will always be operating ambulance services under the authority of California. The issue is the exclusive operating area. So if we are not operating with an exclusive operating area, then the county would be free to contract with multiple providers, and other providers would have the opportunity to provide those services.
Okay. But we're always under the authority of the California EMS?
Yes.
And so, but under the California EMS, it's either going to be an exclusive or it's going to be open?
Correct.
Okay. And if we don't have a local EMS agency, then we probably wouldn't have the exclusive. It would be open, and if we have open, then it's not going to be the same level of service. I'm just diagramming all this out. Is that right?
Yeah, we can't get you can't have an exclusive operating area without an EMS agency.
Right. Okay. And then, why was the 5-year criteria changed to 2 years?
Because in addendum 5, it goes back to 5 years, which is a
Well, I
question
just
I
thought
have.
Colleen, when she responded to Richard, council member,
Right,
council
but in
member,
addendum 5, it
supervisor,
actually goes back to
it went
5,
back.
which is a question I was going to ask.
So what is it? 5 years or 2 years?
It's 2 years.
How come, if I could, I'll wait.
And that's all my questions for the moment.
Okay, Supervisor Baye.
Just, I have several questions, Colleen, but just off the top of my head right now. So when I asked the question about was commitment to labor a criteria, you stated no. But in the sheets that I've just been given, it's one of the questions, evaluator 1, 2, 3, and 4 is commitment to employees. Is that one and the same or different?
It's not specific to union issues. It's
Okay.
regarding different metrics and milestones to ensure employee satisfaction, reduction in injuries, ability to rest during times that they're not active, things of that nature.
Oh, I see, okay. Because that made a big difference in the scoring because Falk got 30 points, and the difference in the overall scoring between Falk and the second company was how many points? You do the math? It's 34, something like that. I just did it. I lost it.
I'm sorry, your question
The
is?
difference, the scoring. What were the 3 different scores you gave? Yeah, overall, 335, 334. What were the numbers again? It's in your sheets. Page 12. Thank you, President. What are the numbers? Can you read those numbers out, please?
I'll do
Falk
it,
got how many points?
355, 331, 295.
355.
31, 295.
Are they here?
So the difference
Oh.
between, that's 24 points? Is that, so if I'm reading it literally as 24 points,
Stop.
and this one question on commitment to employees, if I'm counting the numbers correctly, the difference between the scorers was 30. Was that the deciding question, or how did you aggregate or average these numbers?
So each evaluator score was added together and averaged for the total average score for each.
That seemed to be a
bidder.
key question then, because each of the scorers put Falk up 10 points versus the other companies. 3 of the 4. 3 of the 4 did.
I'm
So
sorry.
I'm just trying to follow your matrix
Yes.
that we were just handed. So it's a little bit difficult because, one, we have the the fact that this is a public session and we've just been handed this document, 7 minutes ago. I haven't been able to evaluate it and go through it, but I have several questions about it. I just need more time. That's my only question for the moment. Thank you.
Supervisor Haggard.
Thank you. Just to follow up, it appears that on that matrix you were just talking about, there are some scores that are a little bit more generous in the points than others, which does skew, in my opinion, what is a 60-point difference between 3 and 1. And I'm just using that just because you used the 40.
Supervisor Haggerty, we can't hear you.
That's good. They can. Can you hear me now? Can you hear me? Okay. I have several questions. Let me follow up with you because I need to understand this because I'm feeling somewhere I'm feeling like I'm not understanding this. In addendum 2, we went to 2 years, correct? In addendum 5, did we then go back to 5 years? Because it says each key personnel listed in this section must have a minimum of 5 years experience providing directly overseeing provisions. Service identified for each position as required by high performance contract to, I don't want to read the whole thing.
So the requirement is that the key personnel have had to have worked 2 of 5 in an ambulance in a 911 system, and that the provider have 5 years of ALS experience.
Okay. Okay, well, I may come back to that. I'm still not feeling. So Falk states in the schedule of charges for Orange County, California, and Los Angeles that when a patient receives ALS services for additional ALS fees added to the CARES ambulance bill, does Falk receive the ALS money or is it passing through the fire departments?
I'm sorry, where are you reading from?
Okay, Falk states in its schedule of charges for Orange County and Los Angeles that when patients receive ALS services for an additional ALS fee is added to the CARES ambulance bill. My point is, what does Falk do with that money? Do they pass it through to the fire department or do they keep it?
I don't know the answer to that, but Falk is here and could answer your question if you desire.
Good afternoon, Supervisor. My name is Troy Hagan with the CEO for Falk, California. The answer to that particular question is we do all the billing for us and the fire service in regards to if they're providing an ALS where they're getting on board of our BLS ambulance, we'll reimburse them the difference, the added portion to that. So Falk keeps the BLS portion, anything over and above that is passed through to the fire department.
So then I guess in Orange and in Los Angeles, are you not the actual ALS provider and in fact the paramedic on the fire rig needs to get onto that ambulance to make that BLS unit then considered an ALS unit?
In that model, that is the model, yes. So the paramedic gets off the engine and onto the ambulance. We provide the ALS service by basically working and partnering with the fire department in that particular system, and then we bill on their behalf and we pass through the dollars back to the fire department.
Okay, so then to staff, when we look at the 911, sorry, there's a lot of paper up here. When we look at item 15, when you're saying 911 operations, and I wanted to stop you there because I wasn't quite understanding what you're saying, but I'll try to go back there. Are you saying the 911 operations were actually ALS units?
No.
Okay, so let me ask this question. Of the 911 operations, because I know what an interfacility transfer is. I'm not quite sure what a backup 911 operation is. But help me understand, it would have been very helpful if by Salem, Oregon, we would have said, okay, it was a 7 years ALS provider. I would have liked to have known. But of these that are in the 911 operations and maybe the backup, which one of those are considered ALS operations?
I know that that Aurora, Colorado is a 911 ALS operation.
Aurora is?
Yes.
Is that the only one?
We actually have several ALS operations. We have Aurora, Colorado. We have Salem, Oregon. We have Detroit, Michigan. We have Alabama and Georgia and Cape Cod. Those are all ALS 911.
So how long have you been providing ALS services in these ones that you just mentioned? You can start with Salem, go to Aurora, then Cape Cod.
2015 for...
I don't want to do the math. You do the math.
Okay.
I mean, I could do it quickly. That was 3, but I don't know when. I don't know when you took the contract.
3 years for Aurora, 3 years for Salem, Alabama, In Georgia, 1994, so that would be 24 years. And Cape Cod and Detroit, I'm not 100% sure.
Are they recent?
No, they've long-standing.
Hmm?
Long-standing in Detroit, and I'm not sure on Cape Cod.
Okay, so of the one in Alabama and Georgia, you do the entire states?
No, all of these are either cities or counties. Very similar to what we would have here. It's everything is broken down into cities and counties.
So are they all, you're saying they're all ALS?
They are ALS systems, yes. ALS 911 systems.
Okay. This may be a question of staff. There's a similar RFP out for San Mateo County that requires 5 years of continuously engaged in providing services required by high-performance contract in the U.S. to primary 911 providers capable of performing ALS for the area of population greater than 700. With the size of the geographical spread, population densities, call volume appropriately similar to those of the County of San Mateo. Did Falk meet the minimum requirements for the bid on this contract? And I'm asking because I believe that the RFP language is very similar.
The language is similar but not identical, and my understanding is that Falk put forward a request for clarification or request for clarification of the minimum requirements and adjustment of the minimum requirements, and was not granted that and did not think it met the minimum qualifications and did not apply.
Okay, so according to Falk's RFP submission, the operations director has been selected. Can you please explain this person's experience in the ambulance operations?
The ambulance operations director is Jesse Alured. He has 8 years of experience working in Contra Costa and Napa local EMS agencies, the last 3 years as deputy EMS administrator in Contra Costa County.
How many years?
8 years.
8 years? Have we verified that? The only reason why I'm asking that question is I'm being, in my notes here, we have 3 years, 10 months.
So my understanding is that these key personnel were verified as part of the minimum qualifications process by the county selection panel.
Okay. Falk
Mr. Alured is also here.
Okay. Does the Falk selected quality manager for Alameda County have the required experience? According to Addendum 5, it states there's a minimum 5 years of experience providing, going back to Addendum 5, providing or directly overseeing the provisions of the service to key personnel. Does the person have the 5 years that was required?
It's a minimum of 2 of the most recent 5 years.
Each of the key personnel listed in the selection must have a minimum of 5 years experience providing directly overseeing provisions of the ambulance identified for each position as required. I'm sorry, in that section that I'm working off of, which is in Addendum 5, I don't see where it's qualified to the way you're saying it. But if we're going to whisper, maybe we could come up to the mic. This is a public meeting.
In the addendum, there was a typo, and there was the same verbiage was repeated twice, and it was only corrected in one portion.
So in this part right here, you're saying it's wrong.
It's 2 of the last 5 years.
Okay. I say it's not right here. So so when I say each of the key, how many addendums were there?
5.
5. So in the 5th addendum, it says each of the key personnel listed in this section must have a minimum of 5 years experience.
It was a
Period,
typo
as
in
far
that
as
it
I'm
was-
concerned.
It was 2 of 5 years.
I know, but it doesn't say that. That's my point.
It says it elsewhere in that addendum.
So should there have been an addendum, and maybe this is a legal question, I'm sure you're going to tell me I'm wrong. That's why the lawyers are here. Shouldn't that have been another addendum to fix that? If that's in case, what happened?
I mean, it may not have been required to submit another addendum to fix that. This is the first that I'm hearing that this error was in the addendum.
So if there was an error there, it should be fixed with another addendum.
Well, if in fact that it was mentioned, I mean, if it was correct in another part and it did in fact include the standard that we were adhering to in the addendum, they have an opportunity, the bidders have an opportunity to ask questions, and then we could clarify. So I'm going to assume that nobody sought clarification with respect to that.
With all due respect, this has probably been one of the wackiest RFPs I've ever been involved in, where we have absolutely no involvement, and then all of a sudden it's dumped on our laps and said, here you go. And so I guess had I had the ability a while ago, I probably would have said, why is it different? You see what I'm saying?
No,
maybe
I
outside of being
understand.
the bidder, I would have caught it and said,
I understand. I would have to defer to the department as to whether or not that was raised, if anyone called that out or asked any questions about it.
it was. Look, this is a public meeting, and making answers to staff like that where the public can't hear and trying to answer my question, I need somebody at the mic to answer the question. I would like the question answered.
It was not called out as a question.
All right. Falk's medical director for Alameda County is currently an ER physician at Kaiser and is medical director for Alameda County, Hayward, Albany, Piedmont, and Fremont Fire. Does this cause any conflicts of interest?
I do not believe that it does. And in fact, I think that it may point to a familiarity with the system.
Donna, do you see any conflicts with that? It's kind of a legal question. You always tell me I'm in conflict, so I'm just trying to figure out, does this create a conflict of interest? Were you not listening to what I said?
I'm sorry.
It's okay if you're trying to get answers to other questions.
Yeah, I was trying to get
All
answers
right.
to the questions.
The question I asked was, the medical director for Falk for Alameda County is currently an ER physician at Kaiser and is a medical director for Alameda County, Hayward, Albany, Piedmont, Fremont Fire. And I'm asking if this is any conflicts.
No, it doesn't create a conflict of interest. Fire didn't bid on this. Fire's not involved in this. So the fact that he's employed that way would not create a conflict of interest.
So, well, let me ask a different question then.
Mm-hmm.
I don't know that this is really into my business, but I've seen this where we have medical directors over at Highland, and then they have private practices. And usually if we were going to have a medical director that the taxpayers are paying for, wouldn't we want to know that that person's working full-time?
If that is a requirement of our position, I mean, as with all employees, if we are paying them for a full-time commitment, we would want a full-time commitment for them. The county, for example, does not have a prohibition on employees working other jobs. Certain employees working other jobs, and the limitation on that is whether or not the other employment creates a conflict with their county employment. My lawyers, for example, we are precluded from working for pay in other jobs, and that's specifically called out in the civil service rules. But for many other positions, there's no such prohibition, and so the standard is just does any other job they perform conflict with their duties for the county?
Okay.
And the job is specified in the RFP is not a full-time job.
Okay. Currently, the Alameda County bundled base rate is $2,099.50. Does that amount represent the amount the county believes its cost to provide a service?
It represents the amount that Paramedics Plus has determined it would charge for services.
Okay, I'm gonna drill down a little bit more on this. But this county gave, I think, an additional $7 million to keep AMR going. Isn't that correct? Is it 7? I'm sorry, Paramedics Plus.
I think it was 4, wasn't it 4?
In subsidies over the last year?
Remember the amount?
I know one was 5.
There were 2 amendments that your
Right,
board
one was 5.
approved that did have a financial impact to the county.
So I guess AMR came in at $2,935. Paramedics Plus came in at $2,227, and Falk came in at $2,295, according to the sheets that were provided. But why is there such a gap between AMR and the 2 bidders? And what I'm trying to do is just get at a real number because, as I said a few minutes ago, we have subsidized this, and what makes us believe that no, we're not going to get in a situation where we're subsidizing yet another provider?
So, Supervisor, the 2 of the bidders assumed that a state-passed piece of legislation would be passed at the federal level that would provide supplemental payments to ambulance providers. Both Falk and Paramedics Plus assumed what's called the quality assurance fee that has already been passed by the California legislature and signed by the governor, would also be approved at the federal level to provide supplemental payments to ambulance providers. So that payment was taken into account in their bids. AMR did not take that into account in their cost structure.
So what guarantee do we have that if it doesn't pass, that they're not going to come back with an addendum?
I posed that exact question to Falk leadership. Falk leadership went to their home office to have that specific conversation with their leadership, and they have assured me that they have the ability to cover the expenses, even in the absence of the quality assurance fee, with the rates that they have proposed.
I'm going to be honest with you. I had those same assurances from Paramedics Plus many years ago that this wouldn't happen. Do you have it in writing? I mean, will it be in writing?
Well, we have in writing the contract, which includes that it does not have a specific opener for the quality assurance fee. It only it binds them to this amount of charges.
So what guarantee do we have that 2 years from now, Falk's not going to come to us and say, we can't do this, we're leaving?
I would say it's the same guarantee we would have from any provider. It is what I know you've been in this situation before. I'm well aware that you've been in this situation before, and that was a hard conversation that we had with Falk directly, that I wasn't going to stand up here and recommend them as a contract for you unless I was convinced that that was true for them, and they convinced me that that was true for them. So I think that that you would be in this situation. I understand you would have questions regardless of the provider, but...
Well, I think Falk should speak to it.
Supervisor, I can attest that everything that the director is saying is true, and so she's definitely made sure that we were going to commit to this number. I brought it back to our investment committee, and just to give you hopefully a little bit more comfort in this, is that being an international company that does this all over the world, is that we have a very robust investment committee that we have to go through, and I had no less than 35 finance committee meetings in regards to this bid. They wanted to ensure it, they wanted to validate it, and make sure that what we were bidding was going to be a good number and a real number, and that we can do it. We're not in the, our foundations certainly don't want to go in and invest $39 million into something that's not going to give them an appropriate return. We did anticipate the quality assurance fee. The quality assurance fee, again, supposedly started on July 1 of this year, and so we're just waiting for the CMS approval on that. But with that, so we bid it, because if we bid it without it, the numbers would be high. And so what happens if in the event that one that goes through, as everyone is expecting it to go through, are we going to lower the charges? We're going to do that. So we went in with our most responsible bid that we could. Now, to answer your question specifically, what happens if it doesn't? And so I brought that back to the same investment committee and our leadership, and they said, we will honor our bid, we'll stick by our bid, and that is what we're going to do. So,
And you'll put that in writing, and would in fact, that if it was in writing in the contract, would that put you in a situation in which you would forfeit the $15 million of letter of surety?
well, that would be the challenge, right? Is that we're not going to lose, we're not going to risk a $15 million letter of surety by saying, well, by walking away. That's a significant amount of money right there, and so that and with the contract.
But right now, I'm hearing it's kind of a discussion between Copenhagen and
it's no discussion, no longer.
And Colleen and you, and I haven't heard one person say, we will put that into contract and this is the way it's going to be.
I believe it's in the contract, I guess was my point. And yes, I'm willing to do that because I believe it's there. The only way that we would ever be able to increase the rates is with your approval, and that's not what we're proposing to do in any way, shape, or form. So I would agree to that stipulation.
Thank you. And then my last question, which is very important to me, and I'm going to explain to you the reason why. When you turn your 911 system over to maybe some sort of private dispatch, you lose the ability to control it. But when things go bad, they come to the Board of Supervisors. And that's where the bad press falls. For example, San Francisco. San Francisco had many problems within their dispatch system, and where people were waiting 24 minutes to even get an answer, things like that. My question to you is, will you be using ACRAC for dispatch?
That is absolutely our intent. We have some steps that we have to go through. We have to go through contract negotiations with Chief Rocha and the department, and with some oversight from the EMS agency. But that is our plan. That's what we proposed and bid, and that's what we want to do.
So I'm just going to say this. I am really uncomfortable that this bid came to us without the negotiations of the dispatch center done, because where we've been talking to labor and we've been shoring up all the union stuff. Probably for me, one of the most important things was the dispatch center, and that's not shored up. And so I can sit here and vote today, and then 2 weeks later find out it's been turned over to a private company and somewhere in Arizona, and they're going to do the dispatching out of there because it's cheaper, and that's not going to work for me. So I don't know how we do this today, but you probably cannot get my vote if, in fact, we don't figure this ACRAC dispatch issue out, because it's very hard to vote. It's saying, go ahead, you're the provider, do what you want, but yet one of the biggest components, in my opinion, is the ability to answer the phone quickly, dispatch the proper unit appropriately, and then get that person to the hospital or whatever they need. And one of the major parts of the component, which is the dispatch system, is not worked out, and that is extremely concerning to me.
Okay.
Supervisor Chan, if I may, I want to make sure that we've provided you with accurate information in response to your question, Supervisor Haggerty. And so my
That's
staff,
helpful.
so my staff has confirmed the issue regarding what was characterized as an error in the RFP. It was not, in fact, an error in the RFP. It requires it's the manner in which addendums are prepared. So when the fifth addendum came out, the instructions on the fifth addendum identified what was being changed from the original RFP. So you need to read each addendum together. And so addendum 2 changed the language to make the standard 2 years instead of 5 years. But addendum 5 is a reference back to the language in the original RFP. Since that language that had been changed in addendum 2 was not being changed, it was not reflected in here. But if you read the addenda all together, it gives you the complete picture of what the final version of the RFP is. So there is no error in the documents.
Does that make sense?
I guess you have to read all of them.
Yeah.
No,
in
I
sequence.
hear that, but if you
Yeah.
read all of them, at one point you're 2 years, next point you're 5
So
years.
it tells you when you look at the instructions on the addenda, they tell you that the only changes are the highlighted information or the strike-throughs. And so when you if you follow that, pay attention to the
Okay, so
instructions.
let
and
me follow that logic for a minute, because maybe I'm just not understanding what it is you're saying. But if it was only the highlighted areas
In Addenda 5.
that have been changed,
Mhm.
then if I read Addenda 5 under qualifications and experience, it says everybody needs 5 years of experience.
Because that's the language from the original RFP. That language was changed in Addendum 2.
So because it was in 2 and not 3 and 4, and we're dealing with 5 now, it won't be highlighted.
It won't be reflected. It didn't need to be highlighted. It wasn't reflected because each addendum is highlighting only the changes to the original RFP, not to the subsequent changes.
Okay, that makes very little sense to me. I mean, I would think that you should have strikeouts and additions off to the side like you do on a legal document.
And that could explain why none of the bidders questioned it, because they understood that that's how the addenda flow.
Well, I think I would be interested to hear if any of the bidders asked for it. And then one last question. The letter from County Council, again, I apologize for all the paper, where it's discussing the issue of fire having the ability to do dispatch. I'm sorry, to do the ALS system. I don't have that letter with me. It was from, I think, the Cal Chiefs or something. You responded to that, didn't you?
So we sent you an attorney-client privileged communication. Are you asking?
Yeah, okay.
I mean, if you have,
Well, I guess
I'm prepared to answer a question.
Let me ask this question this way, because I don't want to walk you somewhere you can't be. The fire chief, submitted to us a document that explained why they believed fire could take over this system, correct?
Yes.
And cited several different reasons why.
Correct.
My question is, you have somebody in your department that works for fire.
There is an attorney in our office that is assigned to provide legal services to the fire department.
Did that individual look at the document that was submitted?
I believe she received a copy of it.
Okay, so we're gonna pull teeth here. Did she? She just so she received a copy and said, "Oh, okay." I mean, I would think she maybe would look at it a little bit closer.
As you know, we have an ethical wall in our office. So because we represent the Board of Supervisors in this matter, and it was anticipated that the fire department would bid to make sure that we were not advising on both sides of this procurement process. We had an ethical wall so that we were not engaged with that attorney regarding matters related to
the answer to your
procurement.
question is you don't know?
I can't tell you that she engaged in exhaustive review of that document, that she analyzed it and what she did.
Is she
I know
here?
she's not
The
here.
mystery person?
She is not in the chambers today.
Okay. It would have been nice if she was here today, because I probably would have had some questions of her. And I realize there is that ethical wall, but it would have been nice to have her here.
Okay. And that her
And
client, that would have been the responsibility of her client to request that she attend.
Yeah, you may now get her here in the next 10 minutes after that comment. Okay, I'm done. Thank you, Madam President.
Okay. I have a bunch of questions, but I'm going to hear the speakers first. Then I'm going to ask my questions. Jonathan Bass, Rob Lawrence, Bruce Lee, and Ignacio de la Fuente. You each have 3 minutes.
I've been serving as counsel to Paramedics Plus for some time with respect to its contract relationship with the county. Just like to say a few words, maybe not 3 minutes worth, about the challenge that you and the county are facing with respect to the future of the 911 ALS service, on which the county's residents, workers, and visitors depend, sometimes for their lives. We had hoped, of course, that Paramedics Plus would continue to serve as the county's 911 ALS provider for many more years. The county may decide to switch to another experienced and capable 911 ALS provider. The county is obviously entitled to do that. Our concern, though, is that the recommendation from the department is not heading the county in that direction. Other speakers can better address some of the technical, managerial, and logistical issues that are critical to the operation and management of a 911 ALS service in an environment like Alameda County. I just want to clarify the legal posture of the bid process. Paramedics Plus pursued 2 levels of administrative review with respect to the qualifications and selection of Falk. We pointed out that Falk did not appear to have the level and type of experience and expertise required by the RFP. At both levels of review, the response we received was that Falk's submission met the criteria and that the evaluation process was handled properly. But as the board knows, all of that is simply procedural responses to the objection and the appeal, not much beyond a check-the-box response. It does not appear that at any level there was a serious examination of Falk's actual experience and qualifications, and some of the responses to the board members' questions have brought that out. If the vetting was actually done in the manner contemplated by the drafters of the RFP, then the RFP itself gives small comfort to the residents of Alameda County. The responses we received to the objections and the appeal filed by Paramedics Plus were carefully framed, but they skirted the central thrust of our submissions, that whatever relevant experience Falk has is not of the type, nature, and quality or depth.
Your time is up.
Thank you.
Good morning, members of the Board of Supervisors. My name is Rob Lawrence. I'm the California Chief Operating Officer for Paramedics Plus, your current contracted 911 service deliverer. First, I would like to thank you on behalf of my organisation for the privilege to serve the county as your 911 provider for the last 7 years. I must begin by saying how disappointed our entire organisation is that the result did not conclude with Paramedics Plus being invited to continue to deliver the service that has taken considerable time, effort, and understanding to deliver in emergency responses up to 400 times a day here in Alameda County. You've heard from our council previously of our writing, our concerns, and which were lodged, and our protests, our appeals, and the overall conduct of the RFP. We're also disappointed that as of today, the information restrictions applied, we've not been supplied with a complete assessment, and some of you have asked those questions this morning. We too would like to see those, and in order to understand the detail of the decision that was arrived at. And as you would expect, we will continue to seek this out, and we'll be applying for a full debrief in the fullness of time going forward. In my short time here in Alameda, I've been here for 6 months, I've come to understand that this is not an area of operation for the faint-hearted. As I'm sure you'll hear from others that speak later on, the fiscal complexity of service delivery here places, whether it's the cost of maintaining the workforce on duty and in place, or the complexity of EMS reimbursement, represents, in effect, a tightrope that you walk on without a safety net. An inexperienced, unprepared, and unaware incumbent and management team will have, I suspect, some extreme difficulty. The maturity, experience, and understanding of the leadership team must be both considerable and credible. In the final analysis, it will be, however, the same paramedics that come to your doors to deliver the service, but the power behind that punch cannot be created without those that have not operated and delivered at this level of true advanced life support complexity, or have personally led a service across such a geography before. I personally have served in both military and EMS for the last 25 years on 2 continents, covering vast geographies. I'm also a full board member of the American Ambulance Association. I have to report that I have to draw on every experience of that every minute of running this organisation here in Alameda County. It is not for the faint of heart, as I've said. An assumption that this can just be picked up and run with by an inexperienced management team is actually flawed and dangerous. Supervisors, that all said, no matter where the result of today's vote goes, win, lose or draw, we pledge to work with an identified incumbent, should you select one, to ensure a smooth transition for the sake of our wonderful, hard-working and life-saving workforce, and of course the citizens who we all have a duty to protect under the public safety umbrella. So in simple terms, we are concerned about the leadership that could potentially come in here, the level of experience and the complexity to run a service such as Alameda County. Again, thank you for enabling us to serve you all.
Good afternoon.
We don't do that, so you choose to speak or not. So you have 3 minutes.
Okay, thank you. Good afternoon, Madam Chair, members of the board. My name is Bruce Lee. I'm the Regional Director for Business Development and Innovative Practices for American Medical Response. Unfortunately, the process run by county staff ended up with a significant flaw, and in our opinion, it's one major flaw, and that is the recommendation of county staff is to your board to select an unproven, unqualified, inexperienced ALS EMS provider. And you've already hit on this around the edges, but I would encourage you to continue this in the interest of public safety and risk to the county government and to the citizens. Falk does not have and currently does not operate anything close to this level. Alameda County EMS is one of the single largest sophisticated EMS systems in the country. And their resume does not support this by any means. In California, and you hit on this earlier, most of their operations in Southern California are limited to BLS emergency systems where fire is out in front providing the services. In Napa and Sonoma County, I think they operate a total of 4 ALS ambulances, not 50 or 60 necessary for the road at any one time in Alameda County. In Detroit, I believe it's a backup system. So you really do need to independently evaluate, for the sake of risk management in this county, evaluate the qualifications and experience of Falk. They are not a bad company, but it's not a good fit. Their resume doesn't even come close to serving the citizens of Alameda County. Thank you very much.
This issue keeps coming up about what they do actually in certain areas of the country. And did we actually call Detroit, or I think it was Cape Cod, or other areas to find out exactly what it is that they are running?
I don't know which jurisdictions exactly were called, but reference checks were done.
Who did that?
Staff for the Healthcare Services
This is staff
Agency.
here.
No, they are not here.
Okay, this is not you. And by the way, thank you very much for picking this up. I mean, this was probably the single largest thing a healthcare director would be involved in, and you got stuck at the end of the game. So I want to thank you. You even asked me about it in my interview.
Huh? You even asked me about it in my interview.
Yeah. So this is not about you. It's been a weird process from the beginning. But this is the second time I've asked a question, and the appropriate staff isn't here. And
those staff have resigned. The staff have resigned.
So the person that, and I know who you're talking about, but so no other facts were done beyond that.
They
No
were
other
well
facts.
documented at the time that they were conducted.
Okay, Madam President, at some point, I'll need Falk back up here at some point.
Okay, Melanie Shelby? No? Okay, I have a couple questions. The provision of services, either to staff or to Falk, the provision of services in LA and Orange County, is it similar to this contract? I mean, in terms of the question that Supervisor Haggerty is asking? Because staff did say that they did talk to those people directly.
Yes, so there are many different things. The hardest thing about an ambulance company is actually the deployment and operations of an ambulance company. It's I'm sure that most of the complaints that you have received for ambulance services over the years is about it took too long to get there, and those different aspects that go along with that. In deployment of a 911 emergency ambulance system, that is key, and I would say Falk is exceptional.
Can you answer my question?
So, but that gets into so the ALS component of this, and again, this is where this RFP was very specific. It's about the key personnel. As one of the earlier gentlemen said, the paramedics are here. It's the same paramedics, whether it's run by Falk, Paramedics Plus, AMR, or somebody else. It's the same outstanding paramedics that are working in the system today. It's about the leadership team that's coming in, and this leadership team.
So my question was, is it an equivalent kind of service you provide in LA and Orange County? That was my question.
From deployment and operations, it's much larger in Orange and Los Angeles County.
Okay, but in terms of the type of service you provide?
That is a BLS model down there. So and that's where the differentiation.
She should just answer a question. It's not. The paramedic from the fire truck has to get into the BLS unit to make it an ALS unit to then go to the hospital. Isn't that correct?
That is correct.
Okay.
From
Just answer her question.
purely the clinical component, I agree, yes.
Okay, all right. So a couple things. This issue of the June 19th deadline that was set, and a lot of that was because there was a lot of discussion about this contract, a number of extensions given over time. I think the boards, from what I remember, the board wanted to have the most competitive process possible, including an alliance model, including whatever other models were out there. So that's what took a lot of time. So a couple of questions. One, what was the cost of those 2 extensions that we had to do? Or 1 or 2, I don't remember what it was.
Primarily revenue losses, so there was an impact of probably close to $6 million to the county. But it was a revenue loss to the county based on the provisions that were negotiated during those two extensions.
Okay. And then, Colleen, you said that it takes, I think somebody said it takes 6 months to certify new trucks. So if we walked backwards from a 6/30/19 deadline, kind of how does it go? Or you can go forward. We only have 8 months between now and then.
That's correct. So it takes 6 months to manufacture and then certify new ambulances. Ambulances are certified by the CHP. So it can take up to 6 months, which is only one element of what has to be stood up in order to take over ambulance services on July 1, including a local headquarters, including contracting with ACREC, as Supervisor Haggerty mentioned, including other elements, the comforts, the stations, the relief stations in the community, the hiring of personnel. All of those things need to happen in the time between now and June 30, 2019.
Okay. So basically, you said earlier that we could apply for extension. We don't know if we'll get it. I know that there was some angst from the state in terms of giving us an extension. They felt that our renewal of the contract with Paramedics Plus materially changed the contract. Is that correct?
That's correct.
So they were very hesitant to do it. And then there was a cost of at least revenue loss of $6 million. So we could expect, 1, we don't know if we get the extension. 2, there could be additional revenue loss if we went beyond that time, because we have to have somebody doing the service, correct? Okay. The other thing is, hold on a second here. I wanted to ask the chief something, the fire chief.
Good afternoon.
Good afternoon. I wanted to ask you, like I said, we had a public session more than a year ago that I called in order to listen to an alliance model. We were interested in looking, the state wanted us to be as competitive as possible, so we wanted to look at that one too. We know Contra Costa had it. We also approved on this board your ability to bid out a contract. Why did you not do it, and why did you not bid on this contract?
So just a couple things as we go into that. While the board had interest in an alliance model, the California Fire Chiefs Association took Alameda County EMS to court so that we could actually bid on or be a bidder on the contract. We did move forward with it with a process to be able to bid on it. We had 3 pre-qualified vendors: Paramedics Plus, AMR, and Falk. Falk chose not to submit a bid to the Alameda County Fire Department. When County GSA reviewed the submitted bids, Paramedics Plus was disqualified in that process for a couple different reasons. So that left us with AMR as the sole bidder. Without competition, I was not able to get to a deal that I could stand before the board and represent as a good deal for the Alameda County.
Okay. That was disappointing. I mean, just from my point of view, it was disappointing. We spent a lot of time making sure the process was totally competitive. The other thing I want to just note for the public, can Colleen or somebody over there, can you talk about in general the procurement process and what the appeals were and all this? It's very hard, and the Board of Supervisors, this is a very big contract and it's very important. On the other hand, I don't want to look at these sheets personally. I don't want to second guess what 4 professionals who we picked to do this is just me, did on this thing, and we have a process at the county for procurement. So if you could just review that for the public, I'd like that on the record.
Certainly. So the County Selection Committee was composed of 4 professionals in EMS, in the EMS system. 3 of them are currently employed professionals. 1 is a medical director, 1 is an EMS director, 1 is a compliance director, and 1 is a former Alameda County EMS director. Those members of the County Selection Committee had 2 elements to their review. They reviewed the proposals themselves, the actual written proposals, based on the criteria that were written in the RFP, and they had individual in-person presentations. Bidders were invited to make individual in-person presentations to the members of the County Selection Committee, at which time the members of the committee could ask clarifying questions or for additional detail. After that opportunity to ask the bidders clarifying questions and the in-person interviews, the CSC panel members were given the opportunity to adjust their criteria in the event that anything that was said in those in-person interviews made a difference in how they scored their written proposals. So the scoring of the overall proposals included 10 points for the oral interviews in addition to 7 other criteria that were listed in a previous slide. So those, the process resulted in the recommendation of a top scoring bidder in accordance with the criteria that was set forward. And during that process, there were no county staff present in order to allow the selection committee the opportunity to make or have open dialogue among themselves without outside ears. So after that selection process was concluded, a notice to award was issued, and all bidders received the notice to award the contract to Falk. There was a bid, protest, and appeals process. Both of the unsuccessful bidders submitted bid protests. Under the terms of the RFP, the bid protests were to be submitted to the Director of Public Health. The Interim Director of Public Health reviewed those bid protests with assistance from County Council, responded to both of those bid protests after a lengthy review process, and upheld the RFP process. After the bid protests were received, the bidders had an opportunity to appeal the response of the bid protest. Both bidders did appeal the response of that bid protest. That response, per the terms of the RFP, went to the Deputy Auditor Controller. The Deputy Auditor Controller reviewed the appeals to the bid protest, also in conjunction with County Council, and issued a final letters that upheld upheld the RFP process and denied the appeals.
So it went through the full level of appeals,
It
two
went
steps.
through the maximum level of appeal steps.
Okay, and then one question for County Council. I don't know if someone else was going to ask this, but there had been apparently some private discussions that I wasn't privy to about whether fire could be given this contract because they are a county agency. Could you tell me your opinion on that?
So based on the research that we conducted, fire, well, I think it's well established, and fire would agree that fire is not a county department or a county agency. Based on our research, county is a dependent special district that your board established pursuant to the Fire District Protection Law. As a result of that, they're an independent body that can sue and be sued, that can hire their own employees. They are governed by a board, which we call the Fire Board, which happens to be the Board of Supervisors. But when you are acting as in your capacity as the Fire Board, that is separate and distinct from you acting in your capacity as a board, as the member of the Board of Supervisors. So they are a separate legal body. They are not an agency or department of the county. Where, for example, Healthcare Services Agency is an agency of the county. The Social Services Agency is an agency of the county. They cannot be sued, be sued separate and distinct. They are the county of Alameda. The Fire Board is not. It is a distinct legal entity. And so based on our additional research and looking at the Fire District Protection Law and the role that it authorizes fire districts to perform, they are allowed to provide ambulance services, but they are not allowed to be the local emergency medical services. That's not, the law does not delegate the ability to perform that function. And in the memos that were provided to us that we believe were prepared by lawyers for Cal Chiefs, the same lawyers who handled the litigation against the county and state IMSA, they did not argue in those memos that the fire agency should be made the EMS agency. Their path to how they could get the contract was that they argued that they were somehow exempt from the EMS, the authority of the state EMS Act, and that you could rely on other law to give it to them. But that law, some of the law that they cited applied to public construction contracts and is found in other parts of the code and is not found in the parts of the state code that govern health and safety.
Okay, thank you. So I know there's other questions, but I just want to say I don't have a dog in this fight. I mean, but to me, it's clear that we have to have a contractor in place by June 30th in a timely manner because, one, we don't know if we'll get an extension. Two, it would be costly to try to extend again, and we're criticized for extending for 3 years without rebidding the contract. We have a responsibility to the people of Alameda County to provide high quality, safe, and efficient transport. I was very interested in the alliance model as part of the bid, but it didn't happen. So with that, I'm going to make a motion to move item 5.1. Yes, but I can make a motion. I'm making, if no one wants to second it, I'm making a motion to move 5.1. Is there a second for discussion?
Madam President, for the sake of discussion, I'll second it, but I will not necessarily support it.
Okay,
For the sake
all right.
of discussion.
Questions? Yes.
Yeah, I wanted to go back to the alliance model. So the alliance model, it's been ascertained that that is a model that can be followed.
I think that is a subject that is up for debate. It has not been determined that it is a model that is prohibited. When we were in discussions at the time, I think it was immediately after we received the letter from state, it was in May of last year, that much I know. In May of last year, when county staff were in discussions with the state EMSA agency, and we point blank put the question to them, if we bid an RFP that follows the model that Contra Costa is following, and that's what I believe everyone is referring to when they say the alliance model, We put that question to the state agency, regulatory agency, point blank, and they told us that it was their recommendation not to follow that model. When the county put its RFP as part of this process to maintain an exclusive operating area, you have to submit your RFP to the state agency before it can be submitted on the street to bidders. The County of Alameda put an RFP before that state agency that had the alliance model, that called for the alliance model, and the state agency did not approve that. They did not refuse to approve it. They simply delayed action on approving it and told us that they could not tell us when or if they would be able to approve it. The county delayed issuing the RFPs in order to allow them to get through that process. And we encouraged them and told them that we were interested in pursuing that RFP. So we were waiting for their decision. Ultimately, they did not render an approval of that process, or of that RFP, when we put it before them. So ultimately, we did issue the RFP that they were willing to approve.
Okay, so I want to have the chief come back up here. So, Chief, you said there were three pre-approved or three qualified vendors, all of which are providers, all of which are here in the room, and only one actually submitted. With two submitted, and only one was approved.
That is correct. So, given the duration of the process, what we ran was a pre-qualification, and all three went through the pre-qualification. Only two submitted bids to be a subcontractor of the Alameda County Fire Department.
And you didn't feel comfortable, or fire didn't feel comfortable bidding on this because you didn't get enough competitive providers to be a part of the alliance.
That essentially is correct. Yeah, the deal that we were able to at least get close to in the end was not one that I could stand before you and recommend, given the overall cost.
So, what was the issue with Paramedics Plus? Why were they knocked out, and then why didn't Falk?
Yes, so that was a county GSA decision. They ran our procurement process.
So GSA made that determination?
County GSA made the...
Can GSA respond?
The determination
GSA
with regard to them. Paramedics Plus may be able to speak to it as well.
Is GSA here? I want to understand why Paramedics Plus was knocked out from the alliance model, and then I want to know why Falk didn't apply. Now, GSA might not be able to respond to Falk, but they can respond to the Paramedics Plus. And if they aren't prepared to respond, I find that Supervisor Haggerty's getting annoyed. I'm going to get annoyed as well. Because people know this is an important matter coming before the Board of Supervisors, and folks should be ready to respond to these questions today.
I think in all fairness to GSA, the alliance model is not the question of the day.
That's not their determination to make.
I understand.
When we did this before, I actually told the director of the Healthcare Services Agency that this is the type of contractual situation that can make or break a career. Now, I'm not referring to Colleen at this point, but this is a very important contract, and all county staff who had a role in it should be prepared to respond.
Can Paramedics Plus answer for you? Do you know why you were disqualified?
And then I'd like to know why Falk didn't want to partner on the alliance model.
Again, Rob Lawrence, Chief Operating Officer, California for Paramedics Plus. So we were, again, disappointed not to be selected through for that. The answer to your question is that there were two issues. One, there was a technical issue with the bid in terms of minor compliance with the requirement of the RFP. In our view, primarily, we had just gone through a sale. We were owned by the East Texas Medical Center. We're now owned by an organization called A&M Capital, now operating as Patient Care Logistics Solutions. And so because we'd attended the pre-bid conference as one organization and bid as another, it all being essentially the same organization, we were disqualified.
Okay, thank you. Now, Falk, because it was my understanding, Chief, that under the alliance model, we possibly would have saved money. They did before Falk responds. Under the alliance model, would we have saved money? That was my understanding.
I think under the alliance model, we believe that revenue could be generated that would be put back into the system. It could
Okay.
not it could not leave the system if we
Okay,
generated
because I
revenue.
want that on the record. So now I'd like to understand, why didn't Falk decide to apply and partner on the alliance model?
First of all, we were excited to qualify for the alliance model and pursue that because we do have other alliance models that we use even in Southern California. The reason that we chose not to is at that time that we were looking at it was when the challenges to the Custer County EMS system came to be and was highlighted, and we didn't know where it was going to stand or where that was going to go. And frankly, we were looking at if we can only bid one, we didn't want to get caught up into something that may or may not happen depending on what happened in Contra Costa. So we decided to bid independently as a more stable platform, I guess you would say.
All right, I can accept that as a response.
And on that, because that doesn't make sense.
I can accept it, but I wasn't going to argue, but I understand. Go ahead.
Well, no, I mean, you weren't only allowed to bid as one because Paramedics Plus didn't bid as one. AMR didn't bid as one. So what made you think you could only bid as one?
That part of it was in timing, I would say. To write two different RFPs at the same time would be incredibly challenging. And basically, you would be writing one and then turn around, and if it would have been released, then you would it would already been public record.
Your statement of you can only bid as one was your company's decision.
Correct.
Based on ability to do the RFPs.
Based off
because the way you answered it, it made it sound like you were only going to be allowed to bid as one.
Oh,
That's
no.
kind of the way your answer led it.
Well, my intent is that from my company's perspective, we wanted to do one really solid bid, and where was the best opportunity for one good solid bid because of one, the timing that was involved, and two, the challenges. We chose that bidding to the county would be in our best interest.
When in fact you are really running an alliance model down in Southern California.
We have some of those contracts that are run alliance model, yes. It's basically a public-private partnership aspect of it. They're all set up a little bit differently, but something similar, yes.
And Chief, who's the firm that represents fire?
Legally?
Yeah.
Is that so? We have a deputy county counsel, Heather Littlejohn, assigned to the fire district.
But
Gastelow Schutten was an outside law firm. They are the same firm that the California Fire Chiefs Association used. The documents that you're referring to were documents that I specifically requested, and given our relationship, had to request through my consultant. So there's not an attorney-client privilege to them.
So this firm, right, Lashrain and Gastelow?
Yes, they're in San Diego.
This firm represents the Fire Chiefs Association?
They represented the California Fire Chiefs Association on trying to bring us into this bid process.
Okay, because obviously different attorneys can have different opinions. You can give an attorney, have them look at that wall back there, and one will say it's white, the other will say it's not, it's off-white or something. They can argue either side. So the opinion that we have here in County Council stated that we have to follow the EMS authority, but here it says that nothing in section 224, its legislative history or EMS implementation regulations, guidelines purport to displace the county's broad sole authority and broad discretion over the provision of emergency ambulance service to indigent persons. So that's one reference here. And then another reference, if I can locate it, because County Council is basically saying the EMS authority has control over what we do, and I don't necessarily agree if I'm reading this accurate. It also states that we can select a provider, and it doesn't necessarily have to be, or actually it says here, counties are free to determine which providers they will use to provide such service, including county fire departments, county fire protection districts, and other county departments, or by contracting with cities, local agencies, or private providers, or any combination above. Now, once again, I don't always dispute county council's interpretation, but once again, they can interpret something one way. I've got another firm interpreting it another way. So I'm just saying, we don't have to go down that path. Is that the impression we get from this legal opinion here?
The impression I have from reviewing those legal opinions is they have a different opinion than your general county council.
And if we went down that path, do you think we would be jeopardizing the quality of service? I mean, will we still have an exclusive? We won't have an exclusive. We might have an open. So do you have any indication of whether or not we would be jeopardizing service, the quality of service?
So operationally speaking, because that's really my side of it, not the legal aspect, we have the Alameda County Fire Department operates the dispatch center. All of the calls come through that dispatch center. We would not be allowing others into that dispatch center. So you would have some level of exclusivity until such time as the issue is resolved.
Let me just ask County Council, would that be legal if we have an open area, not to take calls?
Yeah, so if there's no exclusive operating area, then we would need to allow others to participate, and we would likely be sued if we didn't. What I hear Chief Roach is saying is that unless until we were sued, that he would restrict access.
And with the basic level of service, fire normally is the first one to respond.
That is correct.
Are you also the first to respond with advance?
I'm sorry?
Well, fire. Who normally responds to these emergencies initially? Is it fire?
Usually, most often, fire agency is the first responder agency on scene before the ambulance.
And does it matter whether it's basic, advanced, or critical?
All of our engines, trucks, and our rescue staffed throughout the county, with the exception, I believe, maybe Camp Parks, are all advanced life support units.
And are generally there on the scene before the
ambulance? They are generally on the
scene
before the ambulance.
All right. I rest my point. Okay. Thank you.
Other discussion? Yes.
This whole time we've been dealing with ambulance providers. We've always been told, I believe, that an ambulance is really only good for about 5 years. Is that correct?
On the mileage that it runs as well.
I don't think that's what we were told. I think what we were told was maybe Paramedics Plus can help, but since you're the current provider, weren't we told that 5 years thereabouts is the cutoff date for the useful life of an ambulance based on the mileage? I'm agreeing with you, but we were kind of always told that 5 years is that goal.
That is certainly fair to say. The vehicles are virtually on the road 24/7, 365 days a year, and so they undergo an amount of wear and tear. And so 5 years is a reasonable standard. And I think it's also part of the contract as well.
So what is Paramedics Plus? How often do they feel they should turn the fleet?
We are coming to, must say we are coming to the end of the life of our fleet right now, and clearly that's a consideration that we are.
Well, let's be specific. In Alameda County, what's the useful life of an ALS?
I would say between 250 and 275,000 miles.
Miles. Mm-hmm. And okay, so we'll just we'll keep going until I get to where I need to be. And how many years does it take to get that kind of mileage on an ALS unit?
5 to 6 years.
5, 6 years. Yeah. Okay. Thank you.
Thank you.
So, what is the reason of the length of the contract? And what I mean by that is we're about 4 months short of a 6-year contract. So what is it you were thinking?
So I believe that the EMS agency at the state level allows for up to 10 years of an extension of a contract without going out to competitive bid. So this takes us halfway through that with the ability to extend an additional 5 years for the maximum term that the state EMS agency allows.
So we're not going to get in a situation where we need to give more money because they're going to have to turn the fleet, and the fleet is old at 5 years. I mean, you're telling me that if the fleet needs to be changed, I mean, do we have specific mileage that we tell them they can, how far they can run the trucks?
I don't know whether there are benchmarks in the contract, but I do know that in the current contract with Paramedics Plus, one of the things that we provided as some relief on cost was to increase the level of mileage that was allowable for them to continue to run their ambulances.
That's because we were in a pickle, and I don't think that's the most optimum thing to do. So my question
I would say,
is,
I'm sorry.
no, I'm sorry. Go ahead.
I would say the other element of this is that because Falk is proposing a regional deployment model with staging in the region rather than a central location, the mileage would be less because it's not going from a central location out to the further parts of the county, but rather from a staging area that's within each of the zones in the county.
Okay.
So it could extend the life of an ambulance for that reason.
Okay. But, I mean, wouldn't, because of advances in technology and things like that, wouldn't we not want an ALS unit to get maybe older than 5-6 years anyways, no matter what the mileage is?
I don't know that, one of the providers could speak to this, but I don't know that it's exclusive that that equipment on an ambulance wouldn't also be upgraded over a period of time as needed.
Okay.
Not a whole ambulance all at once necessarily.
I would like to talk to you again.
And the ambulance replacement in the contract is at 250,000 miles.
So, you know, the biggest thing for me is your experience, and that's what I'm trying to get at. We've established that well, let me ask you this first. Will there be a time ever that a Paramedic Plus, an Alco firefighter, a Fremont firefighter, an Oakland firefighter, Oakland, Fremont, you know the examples. Will there ever be a time in which that paramedic will be required in Alameda County, I'm trying to be more specific on my questions, be required to get into a unit to make it an ALS unit?
There is a consideration, I believe, in the North Zone only, that the EMS agency in their RFP was looking for some BLS units that would respond to the priority 4 calls. And so we're not wasting a paramedic unit going to a very, very low acuity call based on emergency medical dispatch done by ACRAC and Oakland Fire, they both do EMD, that in those very, very low acuity calls, let's not waste an ALS paramedic resource, let's send a lower level BLS resource. So we did propose some of those in the North Zone, the city of Oakland.
So, and do the North Fire Chiefs, are they aware we're doing this? The Northern Fire Chiefs that's being referred to, Colleen? So the areas in which we're saying it's okay to send a BLS unit, have we said that it's okay? Are the fire chiefs aware that we will be sending a BLS unit to some areas instead of an ALS unit?
My understanding is that they are aware. It happens very infrequently currently, less than 1% of all of the calls.
But we're changing the model a little bit, though.
I think the model occurs now, but the fire doesn't get reimbursed is the difference.
Okay, well, we don't have a quorum anymore. Is she here? Oh, okay. So, so what happens? So you're telling me if you get a call that a kid fell out of a tree, broke his arm, and you show up and the kid has severed his arm, that's now a situation in which it's an ALS unit, and the only fix would be to put that firefighter, paramedic into the unit, and then it's going to become an ALS unit? Is that what you're telling me?
That occurs, yes. And my understanding is that is a very, very low percentage time that would occur. And so I think a lot of them are more around 5150s, those priority 4 calls. But in that, I don't know if that example of falling out of a tree would actually qualify as a priority 4 call. We would have to work with ACRAC and the county medical director to determine what level or what type of calls are actually priority 4, because that's the only time it's permissible to send a BLS unit is in those very low acuity calls, and so that would be determined by them.
So let's run through this real quick, and I apologize, but this is very important to the county. In Orange, Los Angeles, you run a firefighter model in which you're basically ALS units unless the paramedic jumps in and becomes, then you're basically BLS units. And then when you get to the call, if it's a serious call, then the paramedic jumps in and now you become the ALS unit, correct?
That's correct. We do have a few paramedic units, but most of them are BLS, yes.
Okay, but you're still a BLS unit.
Most of the time, yes.
Okay. Mendocino County, are you a BLS unit until they apply, until they
ALS.
jump in?
That's all ALS all the time.
Yeah, huh?
ALS all the time. It's this type of model. ALS paramedics on our ambulance.
Occidental, California, are you in fact, and please understand what I'm trying to get at here. So you need to be completely honest with me, because if it doesn't work out this way, when I do my fact check, because the person who did this, I'm going to now have to call, he's no longer with the county, so now I'm going to have to call or talk to them through my contacts at CSAC or NACO. In Occidental, California, are you in fact an ALS unit, or are you a BLS unit until the firefighter gets in?
We are an ALS unit.
Salem?
ALS.
I know I'm running through this again, but the answer's kind of changed a little bit. So Aurora?
ALS.
Okay, so,
The only place we do this is Orange and Los Angeles County because that's the model.
okay, well, that cut to the chase. Thank you.
Okay, any other comments, questions? Yes.
So, if we reject all bids because, for instance, the alliance model, had it been put forth, because Fire did not bid on this because they didn't get enough of the providers to qualify to partner with them on their alliance model. Because if with the alliance model, if there's cost savings and we can also provide the same quality of service, we can reject all bids and ask people to rebid based on the alliance model. Can that be a foundation for rejecting all bids because the alliance model is a superior model?
So I hesitate some in answering the question, because when we say the alliance model, I am not sure we're always talking about the same thing. But what my understanding was the model that was put forward was a model that Fire could bid.
Yeah, but they didn't bid, and you heard why the chief said they didn't bid, because Falk didn't put in a partnership with them, because Falk thought they didn't want to go down both routes. Paramedics Plus was eliminated by GSA for some reason GSA came up with, so they only had AMR. So what I'm saying is, if we reject all bids and we get the providers to partner with Fire, and then Fire submits a bid based on that, is that a rational justification for sending this back out? Because I think, as Supervisor or President Chan pointed out, this was delayed because of the whole controversy around the alliance model. But that's been cleared up now.
Well, I'm not sure when you say that it's been cleared up. The CAL FIRE's chief sued, and as a result of that lawsuit, the RFP was altered to allow more favorable terms for bidders, including Fire. And so Fire was able to bid with a partner as a subcontractor as a result of those changes to the RFP. The fact that Fire didn't bid or didn't get people that it wanted to bid, I mean, you could use that if there was no competitive process and you feel that the process was not competitive, that may be a sufficient grounds to reject the bids. However, that reason would be subject to scrutiny by others in a situation where you received 3 RFPs that were competitive.
Sure.
3 bid responses that were competitive.
And I recognize that, County Council, because we've received three RFPs that were competitive, Paramedics Plus, Falk, and AMR, but we didn't receive an RFP based on the alliance model that could have been as competitive and even more satisfactory. And because Fire didn't bid, we go, it goes back to where we were. It's because those three didn't partner.
I mean,
other than AMR, didn't put forth a bid with Fire, and Fire didn't feel comfortable putting that forth because they didn't get competition relative to the other two. So it's sort of like, well, let's have all three bid under the alliance model with Fire so we can see if we can get a more competitive bid that also satisfies our concerns for quality service and cost savings and everything associated with having an effective EMS system in place.
Yeah, the only caveat is I would direct you to the confidential legal opinions that we've provided.
Yeah, I understand. And, like I said, I think attorneys can differ on these matters, and I hate to
And I would just
go a different
I would
route
just
than county council, but
I would just offer that the memos that you were provided don't even address the issues that when I say I direct you back to the memo, they don't even address those issues.
Okay, GSA has the answer to your question, so.
I'm Kimberly Gasway, GSA Chief Deputy. The reason Paramedics Plus was disqualified of their bid was because they had changed ownership, and the RFQ specifically said that all bidders had to be pre-qualified, and the new owners were not pre-qualified, therefore they were not able to bid.
So what if, because they changed ownerships, that they were disqualified, and that's a requirement that we have in place with our procurement?
This particular procurement required pre-qualification of all vendors prior to bidding. They switched companies, and the new company had not been pre-qualified, therefore they could not submit a bid.
So to me, that seems, because I know we probably could have overcome that, because that seems to me to be a very technical, minor concern, and it's unfortunate that that took place. Yeah, I just don't like this. My position, I think we should reject all bids.
Okay, well, we have a motion on the floor, so why don't we take a vote on? Oh, you have more?
I guess I'm troubled by this. This is probably one of the biggest. I mean, each one of us has acknowledged that this is one of the largest contracts that are in front of us, probably if not the most important. And there's only 3 of us sitting here.
Okay, so why don't we continue it till the 20th?
I'm asking that we continue this until the 6th.
We don't have a meeting on the 6th.
I thought we did.
No, we don't. A new schedule was sent yesterday.
Hmm?
A new schedule was sent out yesterday. It's Election Day, and members had asked that it not have a meeting on Election Day.
On November 20th.
So there's no way we could meet? I mean, in the morning?
I don't know. Don't ask me. I'm not the person who's not.
I'm willing to be here. I'm not up. I don't know of any members.
We'll continue it to the next board meeting, okay?
Well, but that's the 20th.
Well, whenever the next board meeting is. Right now, it's the 20th.
I would request that we request a special meeting on the 6th.
Okay, we'll take it under consideration. We have 2 people who aren't here, so if they're not going to be here, we'll be in the same situation that we're in now. Do the best we can.
Wow.
Hey, if it were up to me, they'd all be here.
Well, can I make a motion that we continue this to the 6th?
There is no meeting on the 6th.
No,
I can't.
hold on, Madam President, because I'm not trying to make life difficult. Look, this is, well, all right, do what you want. Fine. We can take it as far as we want. I just think 5 of us need to be here. I was okay with 4. When we got down to 3.
Okay, well, we'll check into people's availability on the 6th. I just, as you know, I have no control over that. So we're going to continue it to the next board meeting. Okay, we're going to go back to the rest of the agenda. Sorry about the set matters, you guys who've been sitting here. Why don't we do the 11 o'clock set matters 2 hours later? So the first one, let's see. This is Can I do it without, can I do it?
You still haven't voted on the mass motion.
Oh, no, I thought we did.
You didn't. You made the mass motion and then you moved directly to item 5.1 discussion.
We didn't take a vote? I said all in favor. We did.
Did she take the vote?
I got Valle, and then Haggerty seconded, and then I got, yes.
Yes, we did take a vote. Yes.
On the mass motion, yes.
Yes.
Oh, okay.
Yes, we did. Can I do the proclamations with only 2 people here, or do I have to wait? Can I do the proclamations without a quorum, or do I have to wait?
You can do it.
Okay, all right. Item 50 is proclaiming October 12th as Individual Placement and Support Employment Awareness Day. Nearly 70% of those with mental health diagnosis indicate they want to work, yet only 10% are competitively employed. Individual Placement and Supports, or IPS, is the only evidence-based practice for individuals who have mental health diagnosis. Alameda County Behavioral Healthcare Services has implemented IPS since 2012. They have served over 600 people and achieved a 40% employment rate. Behavioral health care works collaboratively with other counties to promote best practices and expand IPS to vulnerable populations. The department views employment as a social determinant of health and fosters a culture where employment is an essential element of recovery. Now, therefore, this Board of Supervisors, County of Alameda, State of California, does hereby proclaim October 12th as IPS Support Employment Awareness Day. We have Tanya Morowitz from the Alameda County Behavioral Healthcare Services. If you're still here, I'm sorry it took so long.
Consideration, Board of Supervisors, for reviewing this. I'm very proud to be a part of the IPS evidence-based practice in Alameda County and see that the county is serving a leadership role in educating other counties about adopting this practice. Employment is an essential element of recovery, and in the state of California, there is a 40% gap in income between those who have disabilities and those who do not. So being a part of this is really driving significant change and helping people recover as well as integrate in communities and improve their socioeconomic status. Thank you very much.
Thank you. Supervisor Haggerty, item 51.
Thank you, Madam President. A couple weeks ago, we acknowledged domestic violence and the need to end it in Alameda County. And today, I'm here to proclaim annual Day of Remembrance for those who have died from domestic violence in Alameda County on October 26, 2018. Whereas the County of Alameda, State of California, is nearly 800 land square miles, with a population of 1.5 million, is rich in its ethnic, economic, and geographic diversity. Alameda County supports the Alameda County District Attorney's Office 2018 campaign called Speak Up or Speak Out. Speak up, speak out, not or, both. Domestic violence thrives where we are silent, so we must take a stand and work together to end domestic violence. Alameda County came together under the leadership of our very wonderful district attorney and her office to create Alameda County Family Justice Center, which opened its doors in July of 2005. The Justice Center collates more than 30 agencies that respond to and provide services for victims of domestic violence and their children. The Justice Center has more than 65 offsite government and non-government partners, including the county agencies, with 18 municipal police departments and the Sheriff's Department, who come together to provide comprehensive and collaborative services to victims and their children. And to date, there have been more than 145,000 visits. The Alameda County has created a countywide integrated network services that support victims of domestic violence and those who witness the violence. Children exposed to domestic violence whether victims or witnesses also need our help. Without intervention, they are at higher risk for failure at school, emotional disorders, substance abuse, and perpetrating violent behavior later in life. The Alameda County Family Justice Center, the Youth Empowerment Program, which consists of 123 Read, an arts program, Camp Hope, Kids Zone, and multiple counseling programs, create an atmosphere for children that is committed to being the child's healing and recovery from witnessing domestic violence in his or her home. And the Justice Center and partners have developed a domestic violence report and referral system program that make information and reporting forms available to emergency departments, which is used in 5 hospitals in Alameda County and receives more than 300 referrals a year. The Alameda County Family Justice Center continues to expand its partnership and increase services for its victims of domestic violence. The Justice Center is the model for professionals of all disciplines coming together in order to create a system of collaborative, comprehensive, and effective services response to delivery for victims of domestic violence and their children, survivors of sexual assault, child sex abuse, youth survivors of sexual exploitation and human trafficking, victims of stalking, and elders who have been victims of financial and physical abuse. The Alameda County is a regional leader, particularly for Contra Costa, Solanas, Sonoma, Yolo, Sacramento, Shasta, Stanislaus, and San Joaquin counties, as well as a national leader for FJCs. Under the leadership of the Board of Supervisors and county leaders, the individual cities within Alameda County and the FJC partners, it is prevailing belief that it is essential to provide culturally competent, comprehensive, integrated services, both immediate and long-term, to victims of domestic violence and their children who witness domestic violence. We have broken the silence surrounding domestic violence to reach thousands of survivors, prevent countless incidents of abuse, and save untold numbers of lives. While these are critical achievements, domestic violence remains a devastating public health crisis, one in which 4 women will be physically or sexually assaulted by a partner at some point in their life. We recognize the tremendous progress that has been made, reducing domestic violence, and recommit to making everyone's home a safe place for them. The Board of Supervisors, Alameda County, State of California, does hereby recognize October 26, 2018 as Annual Day of Remembrance for those who have died from domestic violence in Alameda County, and we will endeavor to protect survivors, bring offenders to justice, and change attitudes that support such violence. Let each of us resolve and be vigilant in recognizing and combating domestic violence in our communities, and let us build a culture of safety and support for all those who are affected. So with that, I have Stephen Murphy that's here to accept it. Class for you guys.
On behalf of our District Attorney, Nancy O'Malley, and on behalf of the 14,000 individuals who visit our center at the Family Justice Center every year, I'm Stephen Murphy. I'm the Associate Director there. We want to thank the Board of Supervisors for your unwavering support throughout the years. If it wasn't for you and your support, we wouldn't be able to serve these clients. And we dream of a day or year where we don't have any domestic violence fatalities. This Friday at in the plaza out in front of this building, 1221 Oak Street, we'll be reading the names of all the women and men who have died as a result of domestic violence since 1996. The names will be read by 21 survivors from our center, and then we'll have some poetry and some music and some discussion by our District Attorney, Nancy O'Malley, about how we move forward in the years to come. But on behalf of her and behalf of all of us, staff at the Family Justice Center, thank you very, very, very much for the proclamation and your support. Have a great day.
Thank you. Okay, next we have a short presentation by members of the East Bay Regional Park District, Dee Rosario and the director. This is on Measure FF. They asked to come and make a short presentation.
Good afternoon. My name is Eric Feeler. I'm the Government Affairs Manager for East Bay Regional Park District, and I will be brief. On June 5th, the East Bay Regional Park District Board of Directors passed unanimously an extension of our Measure CC to be placed on the November ballot. It was designated as Measure FF and will be appearing on the ballot. It is a $1 a month parcel tax, and it will be extended with no increase in taxes. The zone for Measure CC is from Richmond down to the Oakland-San Leandro border and from the Bay up to the East Bay Hills. Measure FF will fund wildfire protection efforts, public safety, access, trail improvements, water quality, habitat restoration, and environmental education and visitor use facilities. It will raise $3.3 million a year and $66 million over the lifetime of the 20-year extension. And it leverages at a rate of about 12 to 1. The funds are allocated per capita between Contra Costa and Alameda County, with 78% of the funds going to Alameda County. I'm introducing Dia Rosario, our board member.
Thank you so much for the time. I really appreciate your service here. Measure FF is definitely generates $3.1 million annually, and one of the major expenditures is going to be for wildfire hazardous mitigation areas along the wildland urban interface. And it's, as you know, that's an ongoing project. It's we have 26 miles, 3,000 acres along the wildland urban interface, and Measure FF is a key component of that. And so, along with all the restoration, we're also going to be able to bring on leverage some of that funding to bringing on 2 new parks at the Oakland Army Base and also at Alameda Point. And so I think this is going to be a huge benefit to the constituents of the East Bay Regional Parks, and we ask for your endorsement if that's available.
We didn't list this for action. Has this been through PAL at all? No. Okay. When is the next? Yeah, we won't have one before the election, so I guess as individuals we could just do it. Sorry about that.
Yeah, I know you've already had my endorsement.
Yes.
And you have mine as well.
Yeah, and I support it particularly because it's not an increase, it's just a continuation, but also for the fire protection, the interface, because I know in Castro Valley, the Castro Valley MAC and the constituents in Castro Valley are particularly concerned with the interface with East Bay Regional Parks and the residential wildland interface. And so I know there's some follow-up that I want to have with East Bay Regional Parks regarding that, but this measure is definitely worthy of support.
Yeah, thank you.
Thank you.
You're welcome.
All right, item 53, this is from the county administrator accepting a Gold Spotlight Award.
So just to put back in front of your board the strong leadership role that, with your board's support, the county has had under the leadership of the General Services Agency with regard to climate change and sustainability. Carolyn Blady, who, as you know, heads up that program, is here, and also there'll be a brief presentation to accept 2 awards that your board has received.
Good afternoon, members of the board, county administrator, and directors. I'm Carolyn Blady, program manager for the Sustainability Office in GSA. And today we have the honor of being recognized by the Institute of Local Governments for our climate action leadership and energy conservation. It's through the commitment of this board to both fight climate change and prepare for the impacts of climate change that we're here today. It's also through the hard work of our energy program staff and the General Services Agency that we can celebrate these accomplishments in both electricity and natural gas conservation. A healthy environment, along with thriving and resilient communities, are a cornerstone of the recently adopted Vision 2026. And to achieve this, it'll be critical to accelerate our efforts on conserving energy and water, transitioning to clean energy, and to preparing county agencies to respond to climate impacts such as wildfire smoke, heat, and sea level rise. I feel personally fortunate to work in an organization where the board and the executive leadership are taking the long view, because I think that allows agency staff to innovate solutions to serve the community, and I think we've seen that in the GSA Energy Program. And now I'd like to introduce Carly Brown, the Sustainability Program Manager from the Institute of Local Governments. And I know we're on a tight schedule, but it would be wonderful to do a picture accepting the awards with the energy staff afterwards. Thank you.
Good afternoon. As mentioned, my name is Carly Brown, and I'm with the Institute for Local Government. For those who do not know, the Institute is an affiliate of the California State Association of Counties, California Special Districts Association, and the League of California Cities. We are also a partner of the statewide Energy Efficiency Collaborative, along with the 4 investor-owned utilities and 2 other nonprofit organizations. And that's what brings me here today. ILG and the Statewide Energy Efficiency Collaborative created the Beacon program over 10 years ago to support and recognize local governments' efforts to save energy and reduce greenhouse gas emissions and create policies and programs to address climate change. The County of Alameda joined the program last year in 2017. In that same year, the county was awarded a gold level Beacon Spotlight Award for demonstrating a 14% reduction in agency greenhouse gas emissions. Today, I'm here to present 2 more awards to you. The first is for a 5% natural gas savings in agency facilities, and the second is for 13% electricity savings in agency facilities. I do want to be clear that this is not a greenwashing award, that these awards are for measurable achievements and are based on concrete data. These awards represent that the county is making a concerted and deliberate effort to green agency operations, all while saving the taxpayers' money, conserving natural resources, and contributing to a healthier environment for its residents. The County of Alameda has invested in 13 solar installations that provide clean power and save county taxpayers approximately $700,000 each year. The county has also implemented a variety of energy and water efficiency projects that are maximizing these clean power investments. The leadership this county has exhibited is truly remarkable. The County of Alameda is not only led regional climate action efforts to fight climate change, but is also taking the lead on preparing for climate impacts happening today and in the future. From the policies that start right here at the board, to the inspiration and the dedication from the staff members that I get the pleasure of working with on a daily basis, to the cooperative support of the community, Alameda County is certainly a role model in our Beacon program. So it was with that I wish to present these 2 Beacon Spotlight Awards to the entire Board of Supervisors, the GSA Director, the Energy Program Manager, Tim Wessing, and the current and former Energy Program staff, including Steve Carter, Dan Lichtenberger, Chan Cashel, Steve Rotemeyer, and Chris Gibson. And I'd also like to thank Carolyn and Emily, who have helped me in the application and the coordination of this award. So congratulations to you all, and thank you for your leadership on behalf of the Institute for Local Government and the Statewide Energy Efficiency Collaborative.
Okay, we're going to return to the regular agenda. Supervisor Miley wanted to change his vote on one item.
Yes, I'd like to be recorded as abstaining on item, it was under consent, item 72C. Maybe I'll just, if it's too hard to pull out 72C, I'll abstain on the whole 72. Because, yeah. Yes, the PAL committee had a support on Proposition 10, local rent control initiative, and I want to abstain on that.
Okay, on that one item.
Yeah.
That also.
All right.
So it didn't, so there were 2-2.
Oh, so that didn't pass. Okay. Item 22.
Item 22 is an ordinance.
An ordinance approving the June 4, 2017 through November 12, 2022 Memorandum of Understanding with the International Federation of Professional and Technical Engineers, Local 21, Representation Units 16 and 60.
The second reading.
The ordinance adoption.
All in favor, 3 ayes, 2 excused. Item 23.
23 is the first reading of the salary ordinance amendment.
An ordinance amending certain provisions of the 2017 through 2018 County of Alameda Salary Ordinance.
Move to waive the balance of the full first reading of the ordinance, move for its adoption.
All in favor, 3 ayes, 2 excused. Item 24.
24 is the first reading and introduction of the 2018-19 Alameda County Salary Ordinance that reflects those positions included in their final budget.
An ordinance providing for the compensation and designating the number of officers, boards, and commissions and of assistants, deputies, clerks, attaches, and other persons employed in the offices and institutions of the county and providing rules and regulations relative thereto.
Move to waive the balance of the full first reading of this ordinance, move for its adoption.
All in favor, 3 ayes, 2 excused. Item 34 is a 4/5 vote, so we're going to have to continue it. Item 35, Supervisor Valle said it's all right for us to go ahead. His questions weren't major, so. Motion on 35, please.
Move it.
All in favor, 3 ayes, 2 excused. Item 42.
First reading of an ordinance, traffic ordinance.
Adopt an ordinance amending Chapter 1 relating to traffic regulations county highways and Chapter 2 relating to traffic regulations state highways of Title 6 relating to vehicles and traffic of the Alameda County Public Works Traffic Code.
Move to waive the balance of the full first reading of the ordinance, move for its adoption.
All in favor, 3 ayes, 2 excused. Item 43.
Item 43 is an informational report from the Public Works Agency Director.
Desambet, Director of Public Works. I was requested to present information regarding the upcoming Proposition 6 and its impact to the unincorporated Alameda County. And I have a very brief presentation that basically outlines SB1 and how it came about, as well as the impact of the approval of Prop 6. SB1 was approved by and signed by the governor in April 28, 2017. It was passed by 2/3 of the California legislature. It established a new road maintenance and rehabilitation account that continuously appropriates about 50% of the RMRA funds into local cities and counties. Provides $5.2 billion statewide per year for transportation-related expenditures, and about $29.5 million per year for the unincorporated Alameda County communities. Just as a footnote there, the Federal Highway Administration estimates about for every $1 billion invested in transportation, we're looking at about 13,000 jobs. So the scale of job creation of SB1 is significant. SB1 has very strict accountability requirements and reporting requirements. We proposed to be funded each year, approved by your board as part of your budgetary process through a public hearing process. It provides descriptions and location of each project, scheduled completion time, estimated useful life, and various other information is provided to the California CTC on an annual basis. And these documents are exhaustive and ensure the strong accountability as to how we use the funds. And the type of projects that are eligible for SB1 are road maintenance, rehabilitation, safety projects, railroad grade separations, complete streets. These are active transportation, bike, paid pedestrian project, drainage and stormwater improvement projects, as well as traffic control. And most importantly, we also could use these funds to match for state and federal eligible projects. Already partially in 2017-18, when that was a partial year that SB1 funds start coming into the county, we received about $5.9 million in RMRA funds, and we've already spent those in the East County Overlay Project on Del Val, micro seal projects, programs, overlay in Castro Valley area, Hayward, San Lorenzo area, and pedestrian routes throughout the county. In the current year, your board has approved already $16.9 million in RMRA funds or SB1 funds. And these are the list of some of the projects that will be programmed for expenditure using the $16.9 million of new revenue from SB1. We have, at the beginning of SB1, did a presentation to just a refresher here that Alameda County unincorporated area has some significant needs, close to about $1.2 billion in transportation needs. That's ongoing pavement needs of between $17 to $22 million a year. Rural road needs are about $250 million a year, total. Major corridor projects, $250 plus million. Sidewalk needs about $500 million. Traffic signals about 50. Bridge needs on about $200 million. So this adds up to over $1 billion in transportation needs. So the infusion of SB1 has significant benefits in addressing these transportation needs in unincorporated Alameda County. Your board approves annually now a 5-year capital improvement program for the Public Works Agency. Currently, the current year, you have approved a $295 million worth of planned project over the 5-year period. Of this $295 million, we were planning on using $153 million of SB1 funds. These are $90 million in major infrastructure projects, $80 million in pavement rehab, $68 million in pedestrian bike projects, $35 million in safety traffic signal projects, and $3 million in major maintenance. As you can see, 50+% of these funds are coming from SB1. And this is just hard to read, but it's available in the capital improvement program of the agency that you approved. But a list of projects throughout the county distributed by county board of supervisor districts. When it says various, that means it applies to all county board of supervisor districts. So it's a significant amount of money. And as you can see at the bottom, there's about $282 million total, of which about $153 is from SB1. So what is Proposition 6? Proposition 6 is on the ballot on November 6th. It repeals SB1 tax and fee provisions that pay for repairs and improvement of local roads, state highways, and public transportation. And the second element of the Prop 6 is it requires the electorate to approve any future proposed measure enacting specific taxes or fees on gas or diesel fuel, or for the privilege on the privilege to operate vehicles on public highway, which means it will require the 2/3 public approval of any future taxes on transportation. So the impact of approval of Prop 6 clearly is funding will be reduced by approximately about $153 million under the current 5-year CIP period. Ability to utilize $142 million in revenue source, which is matching funds that are we using to deliver the CIP, will be compromised. Loss of funding, of course, to Caltrans for approximately $442 million within the Alameda County area is another revenue source that a series of projects that will be eliminated. On the board letter that I have provided you, there's a list of Alameda County projects, Caltrans projects within Alameda County, listing the $442 million allocation within Alameda County. So it cancels or delays a substantial number of CIP projects planned for the unincorporated area communities. So it has a substantial impact, at least in our capacity to deliver projects. So this is a brief presentation as to the impact of Prop 6 and the value of SB1 that was requested, I believe, by District 1.
Thank you.
Seems there's a tremendous amount of loss to Alameda County. And please refresh my memory. A position to oppose this.
We did.
Yes, we've come to the PAL committee, and the PAL has taken a committee, and your board has
thank you.
taken a position to oppose Prop 6.
Okay, thank you.
Okay. Okay, we have one more public speaker. Venus, just.
Hello, hi, me again. How you doing today? My name is Venus Gist with Shout Out Justice, and I'm also here in support of CEDAR, the Coalition for Elder and Disability Rights. And I'm going to share this. Many advocates and U.S. citizens have complained of the stripping of their legal rights in the Alameda County probate court system. Basically, the allegedly illegal stealing of families' assets to pay attorneys, conservators, judges, and legal guardians for seniors. This appears to be a nationwide criminal and corrupt enterprise, all committed under the name of the law. But we could complain forever about the injustices of the probate court system. Hold on, I lost my place here. We complain forever about the injustice of the probate court system against citizens nationwide. My question today is, what are the solutions? 2 words: constitutional rights. The law of the land should not lie to U.S. citizens. Am I right? And to our families. For instance, if I'm driving on 580 and I'm doing 100 miles an hour, I'm breaking the law. And there are rules that we have to follow. And this should be the same thing for the judicial system. The next time we meet, Sue Miley, and possibly with District Attorney Nancy O'Malley, this is a very pertinent area that needs to be discussed. What laws have been violated, with our families and our citizens? And we can definitely support and address this and research it, which is what I'm doing now, looking at codes. The Commission of Judicial Commission has a code of ethics that judges and citizens have to follow in the court system. We're very happy to say, though, like I said, we're looking for solutions. And there is a documentary film by Billy Mintz. He's an investigative filmmaker, he's a producer, who has a film out called The Guardians. And this movie depicts the judicial system in Clarks County in Las Vegas, Nevada, and what that county went through with their elderly, being basically neglected and abused by the court system. And I have flyers here for it. It's Human Trafficking in Senior Citizens, Predatory Conservators and Guardians. The Guardians, Saturday, November the 3rd at 4 p.m. It's going to be at 2203 Central Avenue, Alameda, California, at the Veterans Memorial Building. And I think this will give our public a good idea of what's going on so we can address it and make a difference. All right, thank you.
Thank you. Other speakers? None. I forgot to ask County Council, was there any report from closed session?
The board did not take any reportable actions in closed session.
Okay, thank you. Seeing no other business, we're adjourned.